يعطيكم العافية. بس رجاء إذا تعملوا confirmation تسمعوا صوتي. معلش كان عندنا technical issue. كويس، يعطيكم العافية. طيب رجاء إذا ممكن، حاليا وصلنا إلى 89 participant. حابة إذا ممكن تكتبوا لي على الشات what's your background، يعني أي تخصص أنتو. أوكي، وشنو سنوات خبرتكم في الهيلث كير. وكمان حابة أسألكم سؤال. سبق لما كنا نلقي محاضرات أنا كان يطلب منا أن نتكلم بالعربي. هل أنه فيني أتكلم كامل إنجليش أو أنه لازم شرح عربي كمان؟ ما شاء الله دكتور ياسر. excellent. في عندنا consultants nursing all in English. okay. great. We have a lot of population, medical physicians population. okay, great. great. الأغلبية كله English. اوكي. طيب. آم، طيب. في البداية initially would like to agree on our breaks. okay. Because of Ramadan time would like to get 2 breaks إن شاء الله. the first one راح يكون at 9:30, second one at 12. مدة كل واحد 30 دقيقة for 30 minutes. إن شاء الله. قبلها راح يكون، قبل ما نبدأ البريك راح يكون في 10 minutes 5 to 10 minutes for questions. Okay. Let's start. Okay. First of all, مرة ثانية السلام عليكم، يعطيكم العافية. Thank you for joining this session. I would like to introduce myself first. I'm سكينة سعود الهنيدي. Okay. I'm Senior Quality Coordinator in Patient Safety Quality Management Department with background of critical care nursing. It's my pleasure to present this session for you. Please, as I mentioned to you, I will give you time for questions. And in between, I will ask you if you have any questions. Okay, so our objective from this session is to explain the concept of healthcare quality, to demonstrate the significance of healthcare quality, to discuss the aspects of healthcare quality, to memorize the standards and dimensions of healthcare quality, to execute the quality culture assessment, to describe the quality planning process, to identify the selection criteria of healthcare quality indicators, differentiate between input process outcome indicators, also to apply focused PDCA methodology for quality improvement. First of all, we'll start with healthcare quality. So here I will ask a question. What or how do you define equality in general? You can type in the chat. How do you define quality, or what does mean quality for you from your perception, from your understanding? What does mean quality? Also from your experience, because most of you in the medical fields, despite your specialties. الصوت مو واضح. كيف يقطع أو مرة بعيد أو كيف؟ Excellent. Provide perfect service at right time with the first time. With the first time, يعني from the first time. Okay, yeah. Satisfying the patient needs. Excellent. What else? What does mean quality? The standard of something. Okay. high standard of service. Okay, what does mean high standard of service? كمان زميلنا قال provide perfect service at right time with the first time or in the first time or at the first time. Okay, only the right time. Okay, to improve the service, effectiveness of a treatment and accuracy diagnosis. This is regarding the diagnosis and treatment. Thank you, Sarah. What else? طيب. Okay, giving service according to the established standard. Excellent. Compliance to standard. Excellent. So, respect, I think you mean respect patient preference. Okay, delivering service, ensuring to follow the latest guidelines. Okay, guidelines and standards. طيب. So, we'll define the quality. It is the degree to which product, service, or process meets or exceed customer or stakeholder expectations. However, the quality here will not take it only from the perspective of the healthcare. احنا will focus على الهيلث إن شاء الله. But the degree to which product, يعني quality either to your desired product or a service that you would like to enhance it, for example, or deliver it, or related to process that meets or exceeds the customer or stakeholder expectations. طيب, here let me to ask you questions. Who's our customer, okay, in the healthcare? عليكم السلام. Yes, the patients. And who's the stakeholders? Healthcare staff, yes, which is us. Okay, and I prefer to minimize this وأحركها عشان أقدر أشوفكم. طيب. It encompasses various dimensions, including meeting specifications, reliability, performance, safety, customer satisfaction, and value for money. Also, quality can be subjective and context dependent, as different individuals or groups may have different expectations and requirements. طبعا كل هذا, all of this will explain it in details in the coming slides. So, there are some common elements that contribute to the concept of quality across different domains, which are related to the fitness for purpose. Okay, the first element is fitness for purpose. What does mean? It means the quality implies that product or a service is suitable for its intended purpose and meets the needs or the criteria that I expected, or the other party, which is the customer, expected. Okay, it should perform its intended function effectively and efficiently. The other concept of equality or domains, which is related to conformance to specifications. What does mean? Quality involves adherence to established standards, specifications, or requirements. It means meeting predefined criteria and ensuring consistency and uniformity in the characteristics or features or performance of a product or service. From some of your answers, that one of the answers that compliance with the latest guideline or latest updated standards. This is one of the points. Also, absence of defects or errors. Equality implies the absence of defects or errors or flaws that could impact the functionality, safety, or user experience of a product or service. It involves ensuring reliability, accuracy, and consistency in delivery of the desired outcome. Also, one of the other domain in the quality, which is continuous improvement. Our purpose from the quality is not to apply the quality also. It's very important to maintain continuous improvement. So quality is a dynamic concept that involves an ongoing commitment to improvement. It encompasses a culture of continuous learning, innovation, and refinement to enhance process, products, and service over the time. This will explain it also more and more in the coming slides. Here, the concept of healthcare, of quality, from the view of Donabedin framework. So the Donabedin's framework is widely recognized model for understanding healthcare quality. According to the Donabedin, healthcare quality can be assessed based on three interrelated components, which are related to structure, process, and outcome. So the structure is referred to the organizational and environmental factors that influence the delivery of care, such as the facilities, equipment, staffing, and resources. It sets the foundation of the quality healthcare. This is the structure in healthcare. So the structure in healthcare, which is I have the structure, the facility of the healthcare that equipped and with enough staffing, with enough resources, so I will be able to deliver the care. The process of delivering الكير هاي اللي بنسميها, this is the second phase, which is the process. So process refers to specific activities and interventions performed by healthcare providers to deliver the care, as we mentioned. So it involves the interactions between the providers and the patient, adherence to evidence-based guidelines, communication should be maintained efficiently, and coordination to deliver high quality of care. So by that, when you follow the guideline and maintain effective communication and coordination among the different multiple services, by that you will be reached to the desired outcome. What does mean outcome? Outcome is refers to the ultimate results of healthcare, including patient health status, satisfaction, clinical outcomes. It reflects the effectiveness, safety, and patient-centered of care. Here, some of definitions. It's very important to know about it before we proceed with our lecture. What does mean fair safety culture? Let's take from your understanding first. So what does mean safety culture? From your understanding, I'm sure you are working in different size of healthcare organizations. What does mean safety culture? What does mean patient safety culture? Just recently, last year, we conducted a patient safety culture survey as per the Saudi Patient Safety Center. So I'm sure you are aware about it. Yes, شوق بتقول سلوك الموظفين داخل المستشفى. This is part from the culture. اتجاه العمل وجودة العمل. Yes. What else? سلوك الموظفين يعتبر part. Protect the staff and patient from danger and infection, from the harm. Great. Okay, but how you will be able to protect your patient from any danger and infection? Safe environment at workplace. Great. What else? Okay. الرقابة ذاتية. Safety culture refers to attitudes, beliefs, perceptions. Great. Learn from mistake. Yes. When the staff have awareness about just culture resulting in increased yes. Okay. حلو. ربطوا ما بين safety culture و just culture. Great. To the patient. Yes. So let's continue. So safety culture reflects the shared beliefs, attitudes, behaviors within an organization that influence safety practice and patient outcomes. It involves promoting the reporting of errors, learning from mistakes, creating blame-free environment زي ما قالت زميلتنا قبل شوي just culture. So this is the safety culture. Let's go to the patient safety culture and compare between two definitions. Patient safety culture, the concept of patient safety culture emphasizes the importance of supportive organizational culture that prioritizes safety, learning from errors, and open communication among healthcare providers. Yeah, you have to tell me, are they different or correlated to each other? حصغر هذه عشان يمديكم كمان انتوا تشوفوها. سوري يعني هذا اللي أقدر عليه. So what's the difference between both definition? Or are they correlated to each other? Or similar? Okay, sorry ما قاعدة أشوف. It's related, correlated. Okay, can you explain more? شوق ومحمد, what does mean correlated? من أي ناحية؟ التركيز الرئيسي لكل منهما. حلو. طيب. More explanation about that, Sarah, please. They are related, but patient safety culture focuses more on the role of the organization in promoting safety culture. Excellent. طيب, let me to ask you here. What does mean the role of the organization in promoting safety culture? Yeah, I'm waiting your answer. There is a relationship between them. Yes. So what type of the relationship? أوكي. الأول عام والثاني في المؤسسات الصحية. Both of them في المؤسسات الصحية. Both of them في ال healthcare organization. So Sarah, both of them in the units, in the clinics, in the OR, in the pharmacy, in the lab, in the radiology, inpatient, outpatient, this should be implemented. But we can see on the patient safety culture that it is focused on patient. من اسمها because patient safety culture. However, safety culture part منها patient safety culture. Okay, so safety culture. What does mean culture? في البداية culture. Forget about the word safety. What does mean culture? In your understanding, what does mean? Culture, it means environment. Okay, so when you are in a unit or a clinic or OR room, okay, or in the lab or whatever or wherever in the healthcare organization, لكل for each area, for each place, there is a culture, okay? A specific culture for that area or that place. Different than the organization culture at all, okay? اليونت كلتشر او الديبارتمنت كلتشر او البير اوبريتيف سيرفيس كلتشر مثلا اذا راح اخذها على شيء اكبر تعتبر بارت من الاورجنايزيشن كلتشر. اوكي سو الكلتشر هي بيقول زميلنا بلال براكتس تراديشن اند انفايرمنت هي الانفايرمنت. اوكي البارت من الانفايرمنت part from this environment اللي هو الكالتشر include all the values, attitudes and behaviors of that people who are working on that environment. It will build a culture. So, as you know, we have multiple different people from different aging, from different genders, from different nationalities, from different languages, okay, from different knowledge and schools. So this, it will create a culture, okay, that culture could impact the patient and harm the patient. Because as we mentioned initially, our customer is our patient, and in healthcare, we are providing a service to our customer, which is our patient. So our purpose is to provide high quality of care in addition to safety. We have to focus on a safety. In addition to that, we should to follow our vision and mission of that organization. Am I right? So that culture, as we mentioned, could impact and harm the patient. So to avoid that and to prevent any harm to our patient and to our staff, not only for our patient and to our colleagues who are the vendors also, they are working with us, okay, from the other companies, okay, it's very important to the organization to build and enhance and maintain safety culture. Okay, so safety culture reflects that the shared, as we mentioned, beliefs, attitudes, and behaviors within that organization that could impact زي ما قلنا البيشنت safety اللي هو إيش impact البيشنت practice and impact the outcome to the patient. So it's very important to maintain safety culture, okay, promoting by promoting reporting of errors, to learn from this errors, okay. Our purpose from encouraging reporting of errors is to learn from that errors, okay, which is mistakes, and come up with the appropriate action to enhance a safety culture and creating blame-free environment. What does mean a blame-free environment? One of your colleagues, she mentioned it before. Blame-free environment. What does mean بيئة بدون ضغوطات ناتجة من الأخطاء الطبية. Excellent. طيب معنى آخر يا شوق غير معنى أو كلمة ضغوطات. Good environment without mistakes. Mistakes can be happen, Omnia. Mistakes can be happen. You cannot control it. You cannot zero mistakes. You cannot. There is a percentage with the mistakes, but what does mean blame-free environment? Non-punitive environment. Excellent. Yes, so this is what we are encouraging. That's why we mentioned to promote a safety culture by promoting reporting of errors. Yes, when you report errors, sometimes the people are afraid to report. Why? Because that it will be considered against them or taken against them, or against their evaluation at the end of the year, or could be they will not be for recontract. So that's why the purpose from reporting errors is to learn from it, to correct the system, okay, to correct the system for our healthcare providers, so they will be able to deliver high quality of care and safety practice to our staff, to deliver the appropriate care to our customer without blaming. However, still the people accountable about their mistakes. What does mean people accountable about their mistakes? Yeah, for example, let me to take Shog as example. Okay, Shog, let's say she's a nurse and working in a one of the clinic. She forget to check the patient ID band, and she called another patient, which is not the correct patient. And for example, it was for vaccination clinic. and wrong vaccination was given for a wrong patient. From this example, how can I say people accountable about their mistake? At the same time, we should to apply blame-free environment, which is the just culture. Can you hear me? What does mean? People or the staff in the healthcare is still accountable about their errors. Accountable, it means is still the people accountable, responsible about their errors, okay, but to learn from it, not to be against them or to give them a final warning letter or terminating them. We'll explain that more. بس يهمني رجع لما أشوف كده ما في response، يهمني أعرف إنه بتسمعوا صوتي كويس، أحد يكتب إيه أو لا. Yeah, okay, great. طيب, so let's go now to the patient safety culture. Okay, the concept of patient safety culture emphasizes the importance of supportive organizational culture that prioritize safety. قبل شوي سألنا سؤال هنا which what does mean supportive organizational culture that prioritize safety, learning from errors and open communication among healthcare providers. What does mean supportive organizational culture? Or let me to ask you another question. What is the important element in the healthcare, okay, or in your unit or in your service or department to implement patient safety culture or to promote patient safety culture? As a physician, as an individual, only one physician or one nurse, you will be able to apply patient safety culture alone? Focus on a system or a process, no, on individuals. Okay, when we focus on a system or a process, that it will serve the individual by the rules. Okay, what else? By open communication. Infection control. إيش علاقة هنا فيصل infection control? Do you mean to apply infection standards to, I mean the standards to protect patients from infection? طيب كمان خلينا to focus هنا. Okay, هنا supportive organizational culture. هنا بيقول لكم definition, the concept of patient safety culture emphasizes the importance of supportive organization culture. يعني let's say as internal medicine consultant, okay, how you will be able to apply patient safety culture in the internal medicine service. يلا في عندنا internal medicine consultant كان. مين كان معانا internal medicine consultant؟ clear information sharing, continuous education. Yes, هذا كله part من safety culture to enhance the safety culture. But what you need, Sarah, to maintain clear information sharing and continuous education? Are you going to be the only one who support that or to implement that? And how you will be able to implement it at unit level or at departmental level? and also at organizational level. We need a system. Hello, system. You need it. Established system. Okay, who will establish it and who will give you the authority to establish it? Excellent, Sarah. Leadership. Leadership. We need a leadership support, either at unit level or at clinic level or at departmental level. Okay, you need a leadership support to support all the rules, guidelines, and standards to enhance a safety culture. Yes, we need rules, we need policy and procedures, we need guidelines, we need protocols, we need established system to support and enhance safety culture in general and specifically patient safety culture. But how you will be able to apply that when you have the proper support from the organizational. Here is telling you the importance of supportive organization culture. If you do not have the enough and sufficient leadership support, you will not be able to apply a patient safety culture alone. That's why you need a support from a leadership, either in your area or at your service level or الأورجنايزيشن بشكل عام. Okay. By what? By prioritizing safety. They should to focus mainly on safety, not blaming individuals. By focusing and enhancing learning and training and education from the errors. How they will handle the errors. If I have a system, established system to handle the errors. قبل شوي في أحد قال quality team كمان. شو قالت? Yes. Okay, this is very important. Part from that, who's the playing essential role in that? Quality. Quality, by the way, it's not only quality department اللي ماسك quality department in the hospital. Also, in each service, we have specific people or staff assigned for quality task, or كمان في يكون quality specialist in each service. Okay, كمان قلنا learn from errors. Okay, when there is any serious incident happen, when there is any near miss incident happen. Okay, we should our focus and our purpose is not to be focused who did the mistake, who report that, why you have to report it, why you didn't take the permission from us, blah 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 blah. No, we have to focus that error happened, why it was happened, and how can we prevent it. Okay, and instead of focusing why Shok did that, why Dr. Bilal did that. No. And maintain open communication among the healthcare providers. Believe me, from my experience in equality and as a nurse, most of the incidents, a high majority of the incidents, serious incidents and the sentinel incidents happen because, unfortunately, lack of sufficient communication and coordination among the healthcare providers. Okay, do you have any question about that? Policies involve also patients, evaluation and monitoring all the time. Yes, which is very important to maintain the sustainability of the improvement. Okay, so let's to move. What does mean HRO? High reliability organizations. So HRO are organizations such as aviation or nuclear power industries that consistently achieve high levels of safety despite operating in complex and high-risk environments. So the healthcare organizations can learn also from the HRO principles, such as preoccupation with the failure, sensitivity to operations, and commitment to resilience. This is the definition of the HRO and how much important the healthcare organizations should to focus on the HRO principles. Okay, so now we'll move to the standards of healthcare quality from the institution of the medicine dimensions, which is currently known as the National Academy of Medicine, outlines 6 dimensions of healthcare quality in its seminal report, which is related to crossing the quality chasm in new health system for the 21st century. The 6 dimensions or 6 standards, which is related to safe, timely, effective, efficient, equitable, and patient-centered, also known as STEEP, this is the abbreviation, were introduced to guide and redesign the healthcare toward quality improvement. This is the main focus, to redesign the healthcare system toward quality improvement and meeting the quality characteristics of patient-centered. واضحة؟ I think this is clear. So from the institution of the medicine, we have 6 dimensions, which we call it STEEP. This is the abbreviation. S for safely, timely, effective, efficient, equitable, and patient-centered. And the main purpose from these dimensions is to guide the healthcare organization to redesign the healthcare toward quality improvement and meeting the quality characteristics of patient-centered. طيب هنا عندي الستيب first زي ما قلنا safe. What does mean safe؟ حابين تشاركوا حتى لو هي مكتوبة قدامكم. طيب what does mean safe؟ Safe, it means that we are providing safe practice. Okay, we are delivering safe care to the patient, avoiding harm or injuries to the service users. طيب, let me to ask you here a question. What does mean avoiding harm, or what's the different types of harms that we have that we should to consider it here? Is it only physically harm or psychologically also? Be active. Both. Yes, excellent. So harm here, it will include both. Yes. Timely, reducing waste and harmful delays for staff and patients. Effective, based on scientific knowledge for all who could benefit. Okay. So we should to deliver effective care. And efficient, avoiding waste of equipment, supplies, ideas, energy also. Okay, equitable, doesn't vary because of location or characteristics. Okay, we should to apply the same care for all the same patients. Person-centered, respectful of individuals' needs and preference. So, aspects and dimensions of healthcare quality. There are 3 commonly aspects of healthcare quality. We'll start from the beginning. As we mentioned previously, structure, then I have the process, then I have the outcome. And we mentioned previously structure, what it will be include. Can somebody tell us? We mentioned it just before or at the beginning of the lecture. In your organization, what does mean structure? This is basic in all the organization. What does mean structure? The environment. There is a يعني okay, let's to start from the beginning. Before the environment, إيش كمان? What else? Structure. If you need to establish organization, what does mean structure? Culture, equipment and staff. What else? Where you have to put or start your operation. In space, what does mean space? Facilities. Okay, great. So the structure aspect of healthcare quality refers to physical and organization characteristics of healthcare systems and facilities. It involves assessing the resources, facilities, policies in place to deliver the care. The quality of structure sets the foundation for the delivery of healthcare services. So this is the structure. Structure, it means that you have a facility, you have a healthcare system, you have the resources, you have the staffing, you have the policies and procedure, you have the equipment, so you will be able to deliver the care. So example of structure components include the availability of trained healthcare professionals, okay, the presence of the appropriate medical equipment and facilities, the adequacy of staffing level, and the implementation of quality management system, so you will be able to operate these. Okay, so what does mean process? What does mean process? We start with the structure. So how you'll be able to deliver the care now? في عندكم كلام يغشكم كمان تحت. Activities and intervention that we give it to take care of patients. Yes. What else? Sarah, it's okay. So regarding process, when you deliver the care, this we call it the process. Okay, how you'll deliver the care? You have equipment, you'll utilize it. You have a policy, so you'll follow it. You'll implement it. Okay, you have different multiple disciplinary teams that you'll communicate among them. Okay, this communication. Okay, this is, we call it a process. What else? Okay, let me to minimize this. So the process aspect of healthcare quality focuses in how care is delivered to our patients, which is our customer. It involves evaluating the activities, interventions, interactions that occur during the delivery of healthcare services. Process measures assess the adherence to the evidence-based guidelines, protocol, and best practice. Evaluating the process ensures that healthcare services are delivered efficiently, effectively, and in patient-centered manner. يلا أبغاكم تشرحوا لي هدول النقطتين. What does mean؟ يعني نفتح هذا وننزله كده شوي. يلا. What does mean؟ Process measures. يعني معناها إن how you will measure the process and how you'll be able to assess the process. KPI excellent. Okay, KPI هنا مشروحة. يا عبد الله الفيفي يلا. Are you a doctor or what? Or a nurse or what? What's your okay. So what does mean? Process measures assess the okay. يعني if I will ask you how you will be able to measure the effectiveness of the process. يلا هذا question it's not only for Dr. Abdullah, it's for all of you. Despite your experience, despite your position. كل واحد يعطيني from his or her understanding. Process measures, how you'll be able to measure the process, or what's your purpose from measuring the process? What's your purpose from measuring the process? Monitoring the performance. Excellent. Yes. By what? how you will be able to monitor the performance and why you have to monitor the performance. Yalla, you have two questions. The purpose is continuous improvement. Yes, continuous improvement, but how you will be able to measure the process? How you will be able to measure? Yes, they mentioned the KPI, which is the indicators, but how you will be able to measure the process to come up with the KPI? Still, والله الإجابة مكتوبة قدامكم والله. To ensure the healthcare service delivered effectively. Yes, that's why we have to measure the process. رغد ده أعتقد كده اسمك. Yes. أجاوب هنا. يلا. By collection data. Okay. How you'll... طيب, what type of data that you needed to measure your process? What type of data that you needed to collect it, okay, to measure the effectiveness of your process? قلنا benchmarking. Yes, using this tool, you mean to يعني to come up with a KPI. Okay. Auditing. Auditing of what? طيب. To measure your process, you have to assess the adherence. Okay, let me to explain it by this way. For example, you are the manager of, or خلينا نقول chairman of the... لأن عندنا internal medicine، خلينا نقول chairman of the internal medicine department. Okay, الرأس الكبير chairman. So how you'll be able to assess the process in your service that is delivered effectively? You have to assess the adherence of your staff to the evidence-based guidelines, protocols, and best practices. Okay, this is the first important part. You have to assess the adherence of your staff. For example, in the OR, okay, how you will be able in this protocol أو خلينا نقول how you'll be able to decide أن الأوبريشن عندك في OR effective. You have to assess if your staff, okay, they are applying and following the guidelines, protocols, and the best practices. Okay, how you will be able to assess? By auditing. Okay, what you will audit? يلا, what you will audit? You are going to audit everything. You have to set a specific KPI, and based on that, to collect your audit. Yes, sure. When you audit, you should document. Okay. Yes, ask the frontline staff, or it's based on type of the audit that you'll utilize it. Either you'll ask or you'll review command documentation. Okay, you'll review specific points in the system. So you'll be able by that way to measure the effectiveness of the process, compliance to the standards. هذا اللي بنقوله adherence to the evidence-based guideline. Okay, what does mean evaluating the process ensures that healthcare services are delivered efficiently, effectively, and in a patient-centered manner? What does mean? The same when you assess the effectiveness of the process, okay, you will be able to know or to identify if there is a gap, if there is a failure. You'll be able to enhance and come up with the opportunities to enhance the process. Okay, based on that, you will be able to ensure that your system is built enough and efficiently to deliver high quality of care to your patient. Okay, so this is regarding the process. اوكي. وقلنا هنا such as accurate diagnosis, effective treatment. يعني how you'll be able, this is effective treatment by conducting, for example إذا عندك protocol already applied, so you have to do audit if that protocol applied efficiently and correctly by all the users, and what's the outcome على patient, you have to measure that. Okay, and at the end you should to come up with a clear picture, either to continue with that protocol or changes should be applied to that protocol to update it and to enhance it according to the national and international standards of care. Also, patient safety practices, communication between healthcare providers and patients, and coordination of care. كل هذا بيندرج تحت البروسيس. طيب outcome احنا شرحناها قبل شوي بكلامنا. outcome which is the outcome aspect of healthcare quality examines the results and impact of healthcare interventions on a patient health status and well-being. Okay, it involves measuring the actual health outcomes achieved as a result of receiving healthcare services. هذا اللي قبل شوي شرحناه. هذا اللي قبل شوي قلت لكم احنا when we measure the process okay وبعمل عليها انسها enhancement to come up with the clear outcome or desired outcome to the patient. الآن هو بيشرح لك بالعكس، بيقول لك ال outcome okay is the قلنا it involves measuring the actual health outcomes achieved as a result. ال outcome is achieved as a result of receiving healthcare services. هو ناتج من receiving healthcare services. Evaluating the outcomes is essential to assess the effectiveness of healthcare interventions to guide improvements in the health in the care delivery. So measuring the process and the outcome, both of them are important to assess the effectiveness of our care delivery. So these three aspects of healthcare quality are interconnected زي ما قلنا. The quality of structure influences the process of care, which in turn impacts the achieved outcome. By assessing and improving all three aspects, healthcare organization can ensure that their services are of high quality, safe, effective, patient-centered, and delivered positive health outcomes. Okay. How can healthcare organization improve the structure of their service? Do you want to comment on that? Already we explained, okay, and we defined what does mean structure. So the question now, in a healthcare organization, how they can improve the structure of their service to ensure delivering high of quality care. How you'll be able, or what we have to add, or what we have to do to improve the structure of our healthcare organization, okay, to deliver high quality of care. احنا قلنا ايش الستراكشر؟ الستراكشر بيكون بيندرج تحتها facilities, equipments اللي هي resources, staffing, okay, policies and procedure. So when you improve on this, it will improve the structure. So healthcare organizations can improve the structure of their service through various strategies and initiatives. Okay, through what? Through applying adequate resources and infrastructure. Okay. So when you have enough all the necessary resources and infrastructure to support high quality of care, this includes having appropriate medical equipment, facilities, technology system, supplies. Okay, regular assessment should be conducted to identify gaps and invest in upgrading or expanding resources as needed. Okay, education and training. Yes. اللي هو هذا تعتبر بارت من السيستم. طيب كمان other thing which is related to the workforce development and staffing. Okay. من هنا invest in the development and training of healthcare professionals to enhance their knowledge زي ما قال شوق, skills and competences, provide opportunities for continuing education, professional development, specialized training, because you know the organization when hire you, okay, it is the responsibility of the organization, okay, to ensure that you are educated enough and trained enough, okay, to deliver high quality of care to your or خلينا نقول to your customer, which is the patient. That's why apart from each healthcare organization عندي specific department for education and training. Okay, because as you know, medical field, there are a lot of daily updated in the medical fields. That's why you have to be, you have to maintain to update your staff about the latest updated information. Also, because you need it. Why? Because you need to update your guidelines, okay, based on the national and international standards of care. Okay, you need also, as we mentioned, quality management system. Okay, implement robust quality management system that promote culture of quality improvement and patient safety. This will involve the clear policies, procedures, protocols, develop mechanisms for monitoring and auditing process to identify areas for improvement and ensure compliance with regulatory standards and best practices. It's not only to develop mechanisms for monitoring and auditing. The purpose from this, from conducting continuous monitoring and auditing to come up with the appropriate enhancement and actions to be taken to enhance the system and to maintain the sustainability when you apply the changes. Later on, we'll speak about that. Also, you need the information technology and health information system, because as you know, this is playing an essential role to maintain to maintain effective delivery of care. So deploy effective information technology, which is IT solutions and health information system, to support efficient and accurate documentation, communication, and sharing of patient information. This include, which is the electronic health records, computerized physician order entry, decision support system, data analytic tools. IT systems should be interoperable to facilitate seamless exchange of information across different care settings. As you know, that we have a lot of different types of systems now utilized in the healthcare organization to maintain proper communication and coordination of care to our patient. However, unfortunately, we noticed from our practice that that most of the staff, they will be busy with these technologies and these requirements of attention from these apps or from this system, instead of delivering the effective care to the patient. I'm not sure if you are agree with that or not, because some of the technologies, if it is not built and designed efficiently, that require only, like, for example, direct, straightforward information to be entered instead of long information, because by that way it will waste the time of the staff, healthcare workers, and get the attention from them from their patients. Are you agree with that or not? And if you have a comment about that. يعني مع التطور والتقدم information technology that we have it, we noticed إنه الموظفين, they will spend most of the time, okay, just to enter information and data in the system. بدل ما إنه كمان إنه to provide efficient care to their patient. Are you agree with that? And what's, for example, your suggestion to enhance that? اوكي. أم بدون هالخطوة adherence، طيب كيف راح نقيس؟ أم، حب اوكي، مو عارفة اقرأ الاسم، بس السؤال ما هو واضح. انت بتسألي قبل شوية عن البروسيس او بتسألي عن هذا؟ دكتور هبة، هلا حبيبتي. طيب are you asking about the process how to measure it or إنه بتسألي عن الآن النقطة اللي احنا بنتكلم فيها regarding information technology؟ طيب okay, let me to understand your point. So are you do you mean if they will not adhere with the documentation, okay, by utilizing the information technology systems that we have it, okay, how will be able to measure, how will be able to measure what؟ كيف راح نقيس ايش؟ Yes, and I didn't mention that we shouldn't, okay, utilize it or use it, okay, because as you know, this it will replace it, or actually in some of the organization replace totally paper file of the patient. Okay, uh, information technology and healthcare system, okay, I have the positive and negative side. The positive side that I have everything automated مع إن فيها risk, okay, that's why I have a cyber security. Okay, فيها risk إنها to lose the patient information or slowness in the system or shut down suddenly in the system. Okay, yes, I agree with you. But at the same time, what I meant إنه not to take the attention of our staff from our patient care, that should be this system that we have it, or different apps that utilize or electronic health records should be designed efficiently, straightforward to serve the users اللي هم healthcare workers, so not take time from the patient care. Okay, so this is the regarding information technology. أجل لازم يكون في نظام زيادة يحرص على موازنة الوقت والطاقة. That's why when they designed the system should be designed by qualified persons aware about what should be added in the system. Okay, they should to measure how much this it will take time from other staff, because for example let's say النيرس عندي في اليونت, let's say medical and surgical unit could be in the shift 4 to 5 patients. okay, في الاي سي يو عندي 2 patients assigned to the nurse. عندي الفيزيشن let's say فيزيشن عنده عيادة صباح وبعد الظهر إنه بيشوف أكثر من let's say خلينا نقول almost 30 patients. okay, so when you design the system for that should be utilized by the physician, first should be designed efficiently. Okay, all the basic and the required items or fields should be built efficiently, also to be tested before going live and utilized by the physician, how much that will take time from them, from the patient care. Okay, the same with the other healthcare workers also. Okay, I have the other point, which is the safety and security measures. Okay, so implement comprehensive safety and security measures to protect the patients, staff, sensitive information. زي ما قلنا قبل شوي تكلمنا إنك كمان ال automated things فيها high risk to loss information, to loss the data, shut down suddenly. Okay, hackers. This includes establishing protocols for infection prevention, also and control medication safety, patient identification, and disaster preparedness. Ensure compliance with the regulatory requirements and industry standards to minimize the adverse events and promote safe care environment. Okay, so هنا بنتكلم in general regarding safety measures and security measures. Okay, from different types, from security measures either from IT things or from patient side. اوكي مثل على سبيل المثال زي ما تكلمنا regarding establishing protocols and policies, for example for infection prevention, for medication safety, how to enhance the medication, the patient identification, all of that through policies and procedures and guidelines. Okay, here also what does mean or what is related to collaborative partnership, foster collaborative partnerships with the other healthcare organizations, academic institutions, research centers, and community organizations. Collaboration can enhance access to specialized services, facilitate knowledge sharing, and promote innovation. Take the advice or to check the other system so we can enhance our system. Engage in joint initiatives to others' healthcare challenges and improve overall structure and delivery of care. Okay, what's related to the patient-centered design? Incorporate patient-centered design principles in physical layout and workflows of healthcare facilities. Create a space that promote comfort, privacy, and accessibility for patients and their family. Involve patients and their families in the design process to ensure their preferences and needs are considered. Yani some of the systems or some of the process usually will take the opinion of the patients and their sitters or their family about it. I'm not sure if you are aware about the patient experience or patient satisfaction survey. الهدف من patient safety, are you aware about it? أو هل مثلا كنتوا في يوم من الأيام as a patient ومر عليكم patient satisfaction survey؟ Yes. غير عن دكتور حبيبة، يلا ما ادري سوري دكتور هبة. مين كمان يحب يشارك؟ اوكي عندي بدر. طيب so what's the purpose from patient satisfaction survey دكتور هبة؟ Mr. Badr, I'm not sure you are a doctor or what. And the others also. Let's to participate. أهلا وسهلا دكتور. So what's our purpose from conducting patient satisfaction survey? To improve the process and the outcome from a patient view. Yes, excellent. I agree with you. And the value by the patient expectations or feedback. Yes, because some of the process will be enhanced. Okay, or أو إنه البيشنت كمان will trigger our attention for something that in the system or for the gaps in a system that we didn't notice it. Okay, so it will be يعني it will be a good opportunity for us to it will be good opportunity for us to improve and enhance the system. Okay, so for the also regarding continuous infrastructure assessment and upgrades, regularly assess the existing infrastructure and identify the areas that needs upgrades or improvements. This includes evaluating technology system, facilities, equipment, and workflow process. Develop long-term infrastructure plan to prioritize investment and allocate resources effectively. Okay, also we have regarding the regulatory compliance. Stay updated with the regulatory requirements and standards relevant to the healthcare. As we mentioned previously, regularly review and assess compliance with the regulations and accreditation standards. Should be done. Establish a mechanism for monitoring and auditing to ensure ongoing compliance and identify opportunities for improvement. How you will be able to monitor and audit that you should to set the specific KPIs. Sorry, I'm setting the alarm. Okay. So how you'll be able to conduct effective monitoring and auditing. As we mentioned that you should to specify specific KPIs according to your service or to your area, okay, that measurable KPI that will be able to measure it, okay, and based on that you will be able to measure the compliance of your area and your staff. Okay, here regarding the feedback and stakeholder engagement, seek feedback from patients, staff members, other stakeholders to identify the areas for improvement in the structure of service, as we mentioned from the patient satisfaction survey, okay, also from the patient complaints. In addition to that, from staff members, either through بعض organizations, I'm not sure about your organization, they will conduct staff satisfaction survey also, and also from a patient safety culture survey. Okay, so you'll be able by those surveys to get the feedback and to get the voice of the patient and the staff to get their opinion and feedback about the system or the structure. And based on that, you will be able to enhance the system. Engage in the open communication channels to receive input and suggestions. اوكي زي ما احنا بنعرف الآن في عندنا السوشيال ميديا، أغلب الأورجنايزيشنز عندهم different accounts in تويتر، انستغرام، يوتيوب، whatever، اوكي سناب. كمان هنا بيكون في open communication with the other customers, let's say, not patients, okay? So you'll be able also to get suggestions from their side. Actively involve staff members and patients in decision-making process related to infrastructure upgrades and changes. Okay, so we'll continue. How can healthcare organization improve the process to achieve the desired outcome? Okay, so here you'll be able to improve the process. Let me to open the chat. You can remind me, team. Okay, at 9:30 we'll start our break. Okay, so let's to be active. How you will be able to enhance the process. As we mentioned now, the structure, already I have the facilities, I have the equipment, I have the staff, I have the policy and procedures, I have the system, okay? So the process, it means that you'll be able to utilize whatever that you have it in the structure to deliver the care. فهي عبارة عن process of care delivery. Okay, how you'll be able to enhance it? How you'll be able to enhance the process. You should do what? You should to review the process to standardize and streamline the process, okay? To identify the opportunities to standardize and streamline the process across different care settings and departments, okay? By review or by develop a new guidelines, okay? Either you have a guideline, you should to review, to update it according to the national, international standard of care about the latest studies, okay? You should to update it, tested, And after that, if you achieve the desired outcome, you should to maintain the desired outcome or the result that you preferred. Okay, and so minimize unnecessary variation, which is very important in a practice that can lead to inefficiencies and suboptimal outcomes. What does mean minimize unnecessary variations in a practice? When you review the process, maybe you will identify some of the process. Okay, whole process عبارة عن steps, let's say. Okay, you'll find some of the steps that unnecessarily steps that I can remove it, delete it, okay, or replace it with more efficient steps. Okay. طيب لما نقول minimize unnecessarily variation in practice يعني process. Okay. هنا which quality methodology that you should to apply it? If you have any idea about the quality methodology. Okay, اللي هو Lean Six Sigma, that you will be able to remove the waste. طيب, implement care coordination mechanisms, that you have to come up with a mechanism, okay, to maintain efficient care coordination. So enhance care coordination within and across healthcare settings to ensure smooth transitions and continuity of care. Establish effective communication channels and collaborative relationships between different healthcare providers. As you know, medical health records of the patient, okay, it is the automated one, يعني the purpose from automated patient chart or patient file is to maintain effective communication and coordination of patient care. Okay, unfortunately, some of the staff either they don't have enough time to document efficiently or document everything what was done to the patient, or okay, أو إنه ممكن they will face يعني they have their perception about that no need to document. I will not say in detail, but you should document the requirements, the essential information that needed to be known by the others. Okay, this it will cause could be harm to your patient because of insufficient documentation. الdocumentation يعتبر part من communication طبعا. Sorry. Okay. I have here also to enhance medication management, implement robust medication management process to ensure safe and effective uses of medication. This include medication reconciliation, appropriate prescribing practice, accurate medication administration, patient education on medication adherence, utilize technology solutions such as computerized physician order entry and barcode scanning to reduce medication errors. Also improve communication and information sharing, as we mentioned previously about it, enhance communication and information sharing among healthcare providers, patients and their families, utilize standardized communication tools such as structured handover protocol, electronic communication system to ensure accurate and timely exchange of information. Okay, also we have emphasize in patient-centered care, okay, by prioritize patient-centered care by involving patients and their family in care decision, respecting their preferences and values and addressing their individual needs, shared decision-making approach, provide clear and understandable information, actively engage patients in their care planning and self-managed because this is their right. Okay, also implement continuous quality improvement improvement initiatives, foster culture of continuous quality improvement by implementing continuous quality improvement initiatives, engage frontline staff in identifying and address process inefficiencies and opportunities for improvement, use quality improvement methodologies such as BDSA cycles and Lean Six Sigma to systemically identify, analyze, and implement process changes. طيب, let me to ask you about this point. Okay, we have 1 minute. يلا. Did you hear about safety huddle? And can be considered as one of the continuous quality improvement initiatives. يا صحصحوا معايا عشان يلا نطلع بريك. Hello team. Did you hear about safety huddle or safety leadership huddle, or what does mean huddle? Meeting. Okay, yes. Short meeting. Excellent. Okay. طيب. What is يعني what does mean huddle? Short meeting هذا يعني how it will be conducted, why we have to conduct it, what type of information or topics that will be discussed in that huddle, and how can we consider that huddle as continuous quality improvement initiative. We have to check any issue is solved or in progress. Any issue? Khalid? Khalid Al-Asmari. Are you a doctor, Khalid, or what? Can you tell me what's your position, please? ما فهمت إيش APN in our department. Okay. Huddle, it means short meeting, as mentioned by our colleague. Okay, advanced practice nurse. Excellent. Hi. طيب. Huddle is a short meeting, usually 10 to 15 minutes. Okay, shouldn't be taken more than that. Okay, we are encouraging in our organization, and this is one of the initiatives to maintain continuous quality improvement by conducting huddle at unit level, at departmental level, and at organizational level. Okay, and that huddle, for example, let's go to the at organizational level. Okay, some of the organization from Sunday to Thursday, they will conduct daily huddle at organizational level. في هذا الhuddle, okay, it will include and invited all the chairmen, the leaders of the other units, other departments, clinical and non-clinical departments. يعني in that huddle عندي physicians, chairmen, they will attend. عندي maintenance leader will attend. وعندي pharmacy والlab والradiology, other clinical allied health clinical services will attend also. In addition to quality and medication safety unit or pharmacy. ممكن بعض الorganization ما فيها medication safety unit. Okay, but it will be led by يعني one of the director from leadership of that organization in medical clinical affairs مثلا. Okay, in that huddle they will review any serious or any error happened within the last 24 hours. Why we have to bring these issues or reports, okay, to get the attention of the leaders, to take the appropriate immediate action to fix that issue. Okay, And at the same time, if there is any issue that requires a task force or to be forwarded to a specific committee, it will be forwarded immediately without any delay. فطبعا by that you'll be able to maintain continuous quality improvement. Okay, كمان this can be implemented at unit level. Let's say for example عندي orthopedic inpatient unit. Okay, so the head nurse with the nurses, okay, they every shift, okay, or يعني during a day shift would at the beginning of the night shift, for example, they will conduct short huddle. They will review, for example, what any يعني any urgent situation that happened during the last shift or during the last 24 hours. or كمان الهدل هذا كمان one of the purpose of the huddle to share the new things, to announce about new things, or to appreciate even staff. طيب who should to appreciate مثلا you should to appreciate the staff that catch a mistake or catch error. Okay, not to catch it against the staff. لا, when they catch error that, for example, not reach the patient, alhamdulillah, okay, either if reach the patient that it will cause harm or serious harm to the patient. Also, this is one of the purpose from this huddle, okay, because when you encourage and appreciate, when you appreciate staff, you will encourage them to report the errors, not to get scared from reporting, to identify issues that need escalation and resolution. Yes, that's why to report any issues that or concerns even, okay, that need escalation and resolution. Okay, so now we'll stop now for 30 minutes. Please come back at 10. We'll start to continue with our lectures later إن شاء الله الساعة 10. يعطيكم العافية. Do you have any questions? You can يعني write your questions in the chat and I will answer it later on إن شاء الله لما نرجع. You are welcome. Okay. Enjoy with your break. يعطيكم العافية جميعا. العفو خالد. السلام عليكم. يعطيكم العافية. تسمعوني؟ الصوت واضح؟ Okay, great. Okay, شكرا. So let's to start. Okay, so we'll speak now about the significance of healthcare quality. I'm sure now from the previous information that you are aware and now about the significance of healthcare quality. However, regarding demonstrating the significance of healthcare quality involves by showcasing the importance and impact of delivering high quality of care to our patients, healthcare providers, and overall healthcare system. It involves presenting evidence, data, and examples that highlight the benefits and the value of the prioritizing and improving healthcare quality. Demonstrating the significance of healthcare quality involves several key aspects. We'll take the first one from the patient outcomes. As we mentioned previously, high quality healthcare directly contributes to improved patient outcomes, as we mentioned, such as better healthcare outcomes. It will reduce the morbidity and mortality rates, enhance the patient satisfaction, improve the quality of life. From patient safety, quality healthcare focuses on patient safety by minimizing medical errors, adverse events, and preventable harm. Demonstrating the significance of healthcare quality involves showcasing the impact of patient safety initiatives, reducing healthcare associated infections, promotion medication safety, implementing robust safety protocols. Also, from patient-centered centeredness, quality healthcare places patients at the center of the care, respecting their preferences, values, needs. Demonstrating the significance of healthcare quality involves showcasing patient-centered care model, shared decision-making approach, initiatives that prioritize the patients and family and their family engagement and empowerment. Okay, so let me to ask you here a question about, I'm sure aware now how to correlate between quality and patient outcomes, but let me, and I'm sure you noticed that very important that it will reduce the morbidity and mortality rates. Also, I would like to ask you here about how to correlate between quality and patient safety by minimizing medical errors, adverse events, and preventable harm. And what does mean preventable harm? Yeah, the window is open for you to explain for me about this from your understanding. Did you get my question, team? Okay, the question, let's to start with what does mean preventable harm? Doctors, nurses, all of you team, what does mean preventable harm? هنا عندي مذكورة preventable harm. What does mean preventable harm? That the quality healthcare will be focused on patient safety by minimizing the preventable harm. What's that can be avoided؟ إيش هو اللي can be avoided؟ Harms that can be prevented. Okay. What else؟ Poor communication. إيش علاقة ال preventable harm بال poor communication سارة؟ إيش تقصدي فيه؟ Okay, preventable harm, as mentioned by our colleagues, preventable harms that the incident that can be avoided okay, and prevent harm from our patient. Risk management. Risk management شوي يختلف عن preventable harm. يعني خلينا نقول risk situations. okay. هنا نتكلم عن risk، نتكلم عن incidents. اوكي، عندي نوعين من الانسيدنتس. عندي preventable incidents، we can call it كمان near miss incidents، وفي عندي ال actual incidents اللي already happened and reached the patient. اوكي، فهذه نعتبرها medical errors او نسميها adverse events. اوكي، ال preventable harm كمان هذه incidents that harm occurred to the patient while supposed to be can be prevented. كمان ممكن تسمعوا خلينا نرجع للنير مس incidents. هل سمعتوا بهذا المصطلح من قبل؟ near miss incidents. كيف أربط and how can we correlate between quality with the near miss incidents؟ Okay, yes, great. Okay, a near miss incident, yes, event that could make harm, but however, it was catch before it's reached the patient. Okay, so this is near miss incident. طيب, how can these incidents enhance the quality? And why we have to focus on these to enhance the quality? يعني هنا بيقول لي إنه quality healthcare focuses on patient safety by minimizing medical errors, adverse events, preventable harm. How we will be able to minimize these? It means that you have to establish a system, a robust system, okay, to receive these errors, to receive a report about these errors. صح ولا لا؟ So I'm not sure about your organization. Do you have an automated system? We call it automated reporting system by standardize the protocol. Yes. Okay. Do you have in your organization automated reporting safety incidents? Physicians, nurses, team. Do you have that in your organization? اوكي، او ممكن يكون اسمه adverse events. اعتقد كده في بعض الاورجنايزيشنز بيسموها adverse events reporting system maybe. OVR. Okay, yes. OVR. Is it automated? Your name, Jacqueline? Do you have an automated system, OVR? Or still on a paper? Are you reporting on a paper? Okay, automated. Okay. Both. Ah, still you have both. Okay. Interesting. Okay, so طيب, let's to hear from physician side. Are you aware about OVR system, safety reporting system? Because usually يعني rarely if physicians they will report incidents. يعني this is هذا المتعارف عليه. This is what's known about it. يلا غيروا لي انتوا وجهة نظري الآن. I want to hear from physicians. Are you aware about the OVR system in your organization, or adverse events system or safety reporting system? Is it automated? Is it on a paper? What's the process when there is any medical error happened? Are you reporting the medical errors for such or for a specific department? سليمان مالك بيقول automated. Are you physician? Or what's your position, please, سليمان? Okay, so the safety reporting system or maybe أهلا دكتور. So طيب, let me to ask you another question. Are you reporting incidents or medical errors? Okay, great. طيب, so the safety reporting system or what they call it maybe OVR, okay. Usually most of the organizations now they have the automated system which is much accessible and easier to report for the users. Okay, and you have options either to report it under your access, so your name, your email, your contact number will be visible to the other parties. Okay, or you have the other option that you can report it anonymously, and most of the users they prefer to report the incidents anonymously, so their information will not be visible. Okay, طيب. So through this system, okay, you have to report the medical errors incidents, okay, the adverse events, whatever they call it, at the end they call it incidents, okay, medical incidents, and the preventable harm incidents, either reached the patient or caught before reached the patient, that we call it near miss incidents. Or you can report whatever situation that you think or concerns that safety concerns that need resolution or need answer from the quality. Okay, so through these errors that reported through that system, it will reach the quality service. The quality department service from patient safety section, they will receive these incidents, they will review it and analyze it with specific stakeholders from that incident area that happened. Objective or purpose from reviewing and analyzing this incident is to identify first, to know what was happened and why it was happened. Okay, after that you will be able to identify the failures that happen or that led for that incident. Okay, when you identify the failures, you have to classify the failures. We have the individual failures and the system failures. Okay, what does mean individual failures? It means what was the physician done, okay, that led to harm the patient, or what was done by the pharmacist, okay, that reached the patient. طيب, why I have to focus first on the individual failures? Despite that, we are also focusing on free blaming culture, if you remember. Okay, so our purpose from identifying the individual failure first, because it will guide you to the system failure. So this is the main purpose why I have to know the physician, why he did that. Okay, so let me to rephrase it again. طيب, here when I ask the other party why the physician did that, okay, when I ask the question, I'm asking general why the physician did that, or why the fellow did that, or why the resident did that. Don't focus on names, because our focus now here not in person. We are focusing to identify the system failure. Okay, so By reporting these incidents, you will be able, when you analyze it, to identify the failures or the gaps in the system. Based on that, you will be able to take the actions to enhance the system, as we mentioned previously. And based on that, you will be able, when you implement the actions and reach the desired outcome and maintain the sustainability at the end about the changes, you will be able to minimize the morbidity and mortality rates. So like that, you will enhance the patient outcomes. Also, you will enhance the system. You will promote the medication safety. You will promote the safety in general. You will increase the patient satisfaction. Okay. So after that, also regarding accountability and continuous improvement, as we mentioned previously about the accountability, the individual, when he doing the error, okay, or when the error happened by the individual, yes, we are focusing on system, but at the same time, the person is accountable about their error, but without blaming them. You are responsible to, okay, to coach him, to educate him, to train him, to give him the time to be confident to practice very well, okay, under your supervision. So the healthcare quality emphasize accountability and continuous improvement. It involves measuring, monitoring, and evaluating healthcare process and outcomes to identify areas for improvement, as we mentioned. Okay, so from the healthcare system performance, demonstrating the significance of healthcare quality involves highlighting how quality improvement efforts can lead to better organizational performance, higher staff satisfaction, improved reputation of the organization, and increased patient trust. Okay, also regarding the cost effectiveness, high quality care can lead to cost savings and increase efficiency in healthcare system. When you review your process and enhance it and build it efficiently to deliver high quality of care, okay, without harm to the patient, okay, by that you'll be able to maintain cost savings and increase efficiency in healthcare system. طيب, question now. What's the relation between the medical errors, okay, and adverse events with the cost effectiveness? What's the relation between the safety incidents, adverse events incidents, OVR incidents, okay, with the cost effectiveness? Any idea? Yes or no? If you are not aware about it, it's okay, you can write now. Okay, improve the quality of care. With a medical error, I could cause adverse events causing more treatment. Okay, that require more treatment. So it's, what does mean more treatments? What it will consume from you? More cost, more financial. Yes. And what else? Dr. Suleiman, you are a doctor what? يلا come on. Board systems lead to increase the cost on the organizations. Yes. What else? Both of you, you say the same point regarding the cost. More cost at unit level, at service level, at organization level. Yes. What else? Pediatric resident. أهلا وسهلا. Okay. So pediatric residents, I'm sure you are exposed to inpatient areas also. So when there is a harm to your patient, it will increase the cost. What else? Because you should to treat your patient. What else? Okay, you have to treat your patient, so your patient will stay more in your unit, or could be that harm, okay, that led to the patient required high level of care. يعني code activated patient transfer to the ICU that could be required emergency OR, okay, ولا حتى required CT, okay. كل هذا, all of that, this is a cost of money. In addition to that, it will increase the length of stay for the patient. Okay, length of stay احنا نقيسها من ناحيتين. We are measuring the length of stay from two sides. It will cause a cost to the organization. It will be considered against a service. Okay. In addition to that, it will harm the patient. It will minimize the patient satisfaction about your organization. كمان هذه it will be considered. Okay, yes, it will decrease the patient satisfaction. Okay, in addition to that, خلينا نركز على patient satisfaction هنا at this point. Okay, patient has the right to complain and to suit you as organization. Okay, and if when he submit an official complaint, okay, and suit you as organization, معناته هنا I should to compensate by money. اوكي، بعد ما ان الانسيدنت حقته تمر على كذا لجنه، على الام وعلى الكواليتي to analyze it, to decide was there a harm to the patient, was there a delay from المانجمنت medical management deviation from the standard of care. After that, if it is confirmed and a yes, will disclosure to the patient ويكون فيها compensation. فهذه كمان cost تاني. فهنا when we mention harm, okay, harm, I have not only physical and psychological harm to the patient, I have also financial harm to the organization that should be considered. Not only to the organization in general. For example, okay, let's say pediatric chairman, okay, pediatric chairman, as a chairman, you'll be worried إن هذا راح ينحسب from your budget. Okay, it will be considered against you في الM&M rate at the end of the year. You'll be accountable about that. فهذه فيها harm كمان at service level. So that's why to avoid that, yes, may decrease organization recognition. So to avoid that, your responsibility as a staff, as a head, as a manager, as a chairman, whatever the different definition of the managerial position that you have it, okay, it's very important to be sure your process built efficiently. You have an updated guideline, policy and procedures. You have qualified, trained, educated staff, and you have to be sure that your staff educated very well and trained very well sufficiently to deliver the care effectively. Also, if you are receiving orientees, okay, under training, so it is your responsibility to maintain sufficient supervision for these staff, okay, when they will deliver or handle patients. Because at the end, will not blame the junior staff, will blame the system. السيستم ألا وهو إيش؟ include the policy procedures. السيستم include training and education that provided from the service. Okay, so this is regarding the point that I would like to discuss it with you regarding different levels and different types of the harm and how can we correlate it with the cost effectiveness. Okay, Also, how to correlate quality with the external recognition and accreditation. Demonstrating the significance of healthcare quality can involve highlighting external recognition and accreditation programs. These programs assess and certify healthcare organizations that meet specific quality standards, demonstrating their commitment to delivering high quality care, such as SIBAHI and JCI. And, we have different types of accredited bodies. So do you have any comment about that? Did you handle any chapters or modules from SIBAHI and GCI? Did you get boring from updating the evidence and providing the evidence to SIBAHI and GCI surveyors? Okay, let me to tell you from my experience. When we announce surveyors, they are coming soon, for example, let's say next May. All the stakeholders, they will be absent or they would like to take their leaves during that time, which is طبعا not allowed. Okay, some of them, they will get scared. Managers and the head of the departments, they will get scared even, not only the frontliners. Okay, why? Because they will be under pressure that they should to be ensure all the policy and procedures, all the standards updated. Okay, they should to review their practice of care and about renew the license, the certificates required, okay, for their departments and for their staff. However, if this maintained and implemented regularly, okay, over the year, that pressure will not be happened, and you will not suffer from that pressure. But unfortunately, some of leaders, they will keep it until the end, or they will some of the organizations, these things, it will be also monitored by the quality management departments. Okay, there is a responsibility on the quality management department. However, quality management departments, they will facilitate the things for you as a leader. They will guide you, they will push you to renew, to update, to be sure your evidence and policies and procedures, everything that you have it in your service is updated. But the first responsible one is you, and it will be cited against you if that standard not met. Okay, not only on the organization, يعني طبعا هو at the end it will impact the organization. Okay, but this if this monitored and updated regularly, okay, over the year, that it will not happen when the SIBAHI or GCI surveyors come. Okay, so how can healthcare organizations measure and evaluate healthcare quality? Okay, so now you are implementing the quality and applying the quality standards. How you will be able to measure it and evaluate it? Okay, you should to measure the clinical performance. Okay, clinical performance measures are quantitative indicators that assess the effectiveness, safety, and appropriateness of healthcare intervention. These measures can include metrics such as mortality rates, as we mentioned, readmission rates. This it will come on, it will be measured, infection rates, complication rates, and adherence to evidence-based guidelines. Clinical performance measures provide objective data. يعني from these readmission rates, infection rates, complication rates, هذه كلها it will give me an objective data to evaluate the quality of the care provided. Okay. طيب. Regarding adherence to the clinical guidelines, we explained about this previously. Evaluating the extent to which healthcare providers adhere to the established clinical guidelines and best practice is another way to measure the healthcare quality in that unit and in that organization. This can involve assessing the documentation of guideline-based care, appropriate use of medications, adherence to the recommended treatment protocols, adherence to the clinical guidelines, ensures that care is evidence-based and aligned with established standards of practice. طيب, if you noticed, I'm documenting here at the end of each point safety incidents. Okay. طيب, previously we explained to you, I explained it to you regarding how you are reporting the safety incidents, اللي هو adverse events ولا near miss incidents, how you are reporting and how you should to deal with that, and what's the purpose. Purpose from safety incidents or from any error that happened, okay, is to improve the performance, and it will be utilized also to measure clinical performance and to measure كمان the adherence to the clinical guidelines. Am I right? Are you agree with that? طيب, سليمان المالكي, شو تقصد ب we don't have a good knowledge about the protocols? Your pediatric residents وانتباهي كم. ممكن تشرح أكثر؟ ما فهمت عليك. must are not available only. Okay. Do you mean that because you are not much knowledgeable about the protocols, that's why you prefer not to be available during the survivors when they come? طيب, by the way, this is the responsibility of the organization and quality management department. By the way, quality management department يندرج تحته, okay, under quality management department في عندك patient safety section, في عندك الاكريديتيشن سيكشن، في عندك كمان البي اي اللي هو performance improvement سيكشن. اوكي, وكمان بعض الاورجنايزيشنز يكون تحته الريسك مانجمنت سيكشن. و yeah, so it is the responsibility of the accreditation section, okay, over the year they should to maintain regular continuous follow-up with each service about their protocols, about updating their protocols, guideline, procedures, okay, according to the standard of care, and to meet the previous citations from the previous accreditation certificates, okay. طيب, in addition to that, also this is their responsibility to maintain and increase the awareness of the frontliners despite their position, okay, about what does mean SIBAHI standard, what does mean GCI standard, what's the expected questions that will be asked, okay, what type of protocols that should be focused on, for example, من ناحية الفارماسي إيش ممكن يركزوا عليه، من ناحية البري اوبريتيف سيرفيس إيش راح يركزوا عليه، من ناحية infection control, okay, all of that to be shared before the surveyors coming to do the survey. So يعني no one can blame you if you are يعني you are not knowledgeable enough about the protocols. Because فيها by the way دكتور سليمان فيها responsibility from both sides. فيها responsibility من ناحيتك وفيها responsibility من ناحية السيرفيس. يعني أنت الآن من البيدياتريك so you pediatric service they are responsible also to provide you أنت as a resident. أنا بعرف الريزيدنت مظلومين مساكين okay to provide sufficient knowledge and training to the residents before even handling the patients. okay بالعادة احنا بنعمل orientation. في عندنا orientation program to the residents وفي orientation program to the fellows okay about ال general policies that they should to be aware about it, about مثلا any automated system that they should to utilize it okay how to utilize ال medical health اللي هو electronic medical health records for the patient in detail بينعطى orientation program. In addition, what's supposed to be the policies that should be focused on. Okay, these policies will be shared with them through their emails, so they will be able to read it later on during their off duty or whatever suitable time for them. Before السباهي or GCI or accredited body visit, usually will conduct orientation program for all the staff despite their positions, also about the general questions والgeneral expectation from الGCI or سباهي what they will ask. يعني فيها responsibility from two parts. I agree with you still in some of the staff they will get scared from that. طيب let's to go back to my question. How you will be able to utilize safety incidents okay to measure clinical performance and to measure adherence to clinical guidelines. Adherence to the clinical guidelines. Safety incidents اللي هي OVR. KPI و question mark. What does mean طيب؟ ما فهمت أنا الآن. يعني to be used as a KPI اللي هي safety incident to be used as KPI. Yes. Yes. You are right. Okay. يعني مثلا على سبيل المثال pediatric service زي ما قلنا at the end of the year okay each chairman وeach service responsible إنه to generate a report about all ال M&M cases incidents. ال M&M هذه إيش يعني معناتها إنه في could be deviation from the standard of care okay that led to harm to the patient that caused morbidity to the patient. with safety incidents طيب how they will be able to decide these cases for M&M وهذا ال M&M rates اللي عندي من ال safety incidents okay that's why صح كلام الدكتور إن it will be used as a KPI. طبعا أنا I will use the safety incidents as a KPI اللي هي safety serious incidents that led for serious harm. In addition كمان sentinel serious incident. What does mean sentinel serious incident? يلا physicians أنا team. What does mean sentinel serious incident? Did you hear about it? في حد معانا من الquality؟ هل في مرة سمعتوا في السيرفيس والله عندنا sentinel incident وتلاقوا الليدر ولا المانجر معصب patient is harmed due to medical error. Yes ما هي safety incident بس إيش معنى sentinel؟ إيش الفرق بينها بين sentinel serious incident وإيش الفرق بين serious incident؟ خالد الأسمري إيش yes to what؟ even that result in death, permanent harm or severe temporary harm. Excellent. Yes. Medical error leading to death, not only for death by the way, huh? Not only for death. Either led to death that can be prevented or led to permanent physical harm to the patient or could be led to the temporary لكن severe harm to the patient. Okay, yes, physical serious event كمان, yes. Okay, بس what does mean sentinel؟ إيش الفرق بين السيريس وما بين السنتينل؟ هذا كله يندرج تحت serious incident. بس إيش الفرق بينها وبين السنتينل؟ السنتينل incident okay في عندنا specific types of serious incidents إذا صارت واحدة منها okay when it's happened that should be reported to إلى مين؟ يلا في أحد يعرف أو في أحد يتذكر الآن؟ should be reported for one of the لا بطريقة أخرى إلى مين؟ not MOH. يس ما هو الكواليتي أساسا بيكونوا على راسكم دكتور خالد. هم أول ناس راح يوصلهم الريبورت. Sentinel portal under what? The board of the organization. Yes وراح ناكل الهوا من البورد of the organization. What else? external ما راح أقول أكثر من كده. يلا واصلوا حاولوا. To be reported to سباهي. Sentinel serious incidents it will be considered against your organization specifically your service. حلو. طيب that's why بتشوف المانجرز معصبين. طيب in addition to that a serious incident okay معناتها serious harm led to the patient or led to the death okay either led to the permanent or severe temporary harm or إنه led to death preventable death. طيب هذه immediately when it's reported to the safety reporting system ولا ال OVR بتوصل للكواليتي بيفتحوها بيعملوا review and analysis بيكلموا ويصجوا العالم كلها اوكي اللي عارف هذا الشيء من الكواليتي بيعرف هذا النوع من البريشر من على السنتينل. anyhow okay they will analyze it almost within and investigate it almost within maybe 24 to 48 hours. Sentinel report will be created. Sentinel committee meeting will be conducted. It will be led by medical clinical affairs okay or could be led by healthcare allied healthcare system. Okay, لا هذا قبل ال RCA before RCA Jacqueline before the conducting RCA okay this is we call it initial investigation preliminary investigation for this serious sentinel case okay so the committee the purpose from conducting a committee is to go also okay through the serious sentinel with a specific team. Okay, I have a specific committee members will present the case in front of them okay with our findings okay findings هذه يعني failures gaps that we identified from our analysis and our investigations okay we compare it with our guidelines and protocols يعني was there a deviation from the standard of care or not. طيب after that when we presented and discussed it in that committee with the expert people will decide it is serious incident okay there is no question on that there is no doubt in that it is serious but is it sentinel or not okay what does mean sentinel يعني to be reported to سباهي within the first 5 days from the incident date. That's why بيكون الشغل عليها بسرعة بحيث إنه not to miss anything at the same time okay we'll work on it very quick within 24 to 48 hours but without any excuse to miss anything. We'll analyze it carefully in detail. Anyhow it will be reported to the Sibahi within, after when they agree this is a sentinel, it will be reported immediately within a specific form, will be filled and sent to specific email to Sibahi. After that, RCA, yes, as Jacqueline said, RCA, which is root cause analysis, will be conducted. Specific team member will be created. RCA will be handled by the quality management department usually. Okay, they will go through the incident in detail also to come up with the clear actions to improve the system. At the end, this RCA should be completed within 30 days as per the Sibahi standard. As per GCI should be completed within 45 days. بس usually علشان ما ننحسب إن إحنا تأخرنا على سباهي standard, that's why يعني we prefer to complete it within 30 days. Otherwise, if you will go with the GCI standard can be completed within 45 days, Sibahi, this will be cited against you. Okay, so actions at the end will be decided and memos will be released from quality to the involved stakeholders to the services with the actions that they should to implement it with a specific time frame. متى لازم تكمل تخلص هذه actions to be implemented. و after 30 days زي ما قلنا will communicate again with the Sibahi about the CAB. What does mean CAB? اللي هو ال corrective action plan that was taken from this RCA meetings, okay, will be shared with the Sibahi. But what's your rule with the quality management team? Your rule as involved service that to ensure these actions is completed, assist carefully, we are agree and satisfied about the desired outcome of these actions. After that, we'll maintain the sustainability of the to maintain the sustainability. Okay. So this is regarding safety incidents. Any questions so far? Okay, so how to correlate between equality and patient experience surveys? Patient experience surveys such as the consumer assessment of healthcare providers and system. Okay, gather feedback from patients about their healthcare experiences. These surveys assess aspects such as communication with healthcare providers, access to care, coordination of care, and overall patient satisfaction. As we mentioned previously, it will give you it will provide you valuable insights about the patient's perspective and help evaluate the quality of care from their point of view. Okay, also another thing which is peer review and clinical audits. Okay, peer review involves the assessment of healthcare professionals' performance by their peers or colleagues. A clinical audit involves reviewing patients' records, procedures, and process to identify areas or gaps for improvements, as we mentioned previously, and ensure compliance with the quality standards. Can you tell me what type of peer review that can be implemented in your services or in one of the service in your organization? Peer review, is it implemented in your organization and in which service? Yes or no? I think residents, physicians, maybe they will be aware about this more. Peer review. Okay, peer review, for example, yes, documentation. Okay, what else? في عندك دكتور سليمان, peer review can be implemented also in the radiology service. يعني we noticed يعني we have some of the incidents related to, unfortunately, missing reporting radiological findings that must not reported by the radiologist when they review the images or when they interpret the images. Okay, so يعني one of the action that can be implemented to enhance that is to conduct peer review. But however, still it will be difficult to conduct peer review for all the images. Okay, especially if you have a huge complex healthcare organization with a huge number of patients. Okay, so but هذه تعتبر one of the measures that can be implemented to enhance the quality. Okay. Also, regarding comparative data and benchmarks, a healthcare organization can compare their performance against external benchmarking or internal. Okay, and comparative data to evaluate healthcare quality. How you'll be able to compare your performance against external benchmarkers and internal benchmarkers? Do you have any idea about that? هل معنا أحد من infection control nursing كمان؟ طيب العام الماضي كان في ال patient safety culture survey. could be national كمان. اوكي مضاوي بتقول external benchmarking equal to international, could be international or national at national level. Yes. Okay, internal within the same organization. Great. Can you give example? طيب for example to that, okay, like for example hand hygiene. Okay, this can be compared comparing with the other units. ICUs مع ICUs. Okay. هذا على سبيل المثال internally. طيب let's to continue. Here also regarding accreditation and certification programs, many healthcare organizations seek accreditation and certification from recognized bodies such as JCI or the National Committee for Quality or the Healthcare Facilities Accreditation Programs. These programs assess healthcare organizations against predefined quality standards and provide an external evaluation of healthcare quality. That's why very important to get this certificates. Okay. طيب let's move to the quality culture and quality culture assessment and quality planning process. طيب, what does mean quality culture assessment? Quality culture assessment is a systemic evaluation of the organization's culture and its impact on the delivery of high quality of care. It involves assessing the shared values, beliefs, attitudes, and behaviors within the organization that influence quality related practice and outcomes. Okay, quality culture assessment helps to identify strengths, weaknesses, and opportunities for improvement in healthcare organizations. It's a valuable process for healthcare organizations to evaluate and enhance their commitment to quality and overall culture surrounding it. Okay, here are the key steps involved in executing quality culture assessment. طيب, before starting that, I'm sure you are aware about culture because we already defined previously what does mean safety culture and what does mean patient safety culture. However, how you will be able to assess this culture? How you will be able to assess a safety culture or patient safety culture in your organization from your understanding. طيب, let's not to forget last year as per Saudi Patient Safety Center patient safety culture survey was conducted. إذا تتذكروا الدومينز اللي في السيرفيز, هل عبيتوا السيرفي أولا؟ Survey and monitor compliance. Yes, أنا يهمني الآن what was the domain or what were domains of that survey. Do you remember it? لما عبيتوا السيرفي, when you filled the survey, what was questions, domains related to what? Okay, so regarding patient safety culture survey, okay, some of the domains were related about yes, patient identification, medication management, related to the teamwork, related to leadership support, regarding error management, okay. So these things, when you assess it, you have to assess it. How you'll be able to assess it? By conducting survey. Okay. In addition, also you'll be able to assess it through السيفتي ريبورتنج سيستم من الانسيدنتس كمان. ما هو الكواليتي تيم members او البيشنت سيفتي سيكشن في الكواليتي members كمان they will assess and analyze الانسيدنتس هذه. I should to classify it. I have to add specific types for specific groups of incidents. Okay, based on these incidents أنا I have to it will give you or it will give you reflection about the culture of specific units or specific services. Okay. كمان reporting, yes, it will assess reporting, learning كمان, education. Okay, so how you will be able to assess the quality culture assessment. But first of all, you have to establish objectives. What's your objectives from this assessment? Okay, so you clearly define the objectives and the goals of the quality culture assessment. This may include assessing the current quality practice, identifying the barriers to quality improvement, evaluate the staff perceptions about the safety, attitudes, their beliefs about safety, or even about they assess their knowledge about quality and safety, identifying the areas where the organization needs improvement. طيب هذه من ناحية establish objectives. كمان one of the objectives is each organization has specific KPIs. أنا ال KPI عندي not only at unit level, not only at service level. Okay, عندي organizational KPI, عندي الميشن والفيجن, صح ولا؟ So all of these, okay, I should to consider it when I assess the quality culture. طيب ليه؟ لأن why I have to consider that? Because راح يهمني كثير. Okay, because it is very important to me when I got the result of this assessment. طيب, after that, when you define the clear objectives, you should to select the appropriate assessment tools that will be utilized to assess the quality culture. As we mentioned, the surveys, okay? So you should to determine the appropriate assessment tools and methodologies that will be used to gather data and insights about the organization quality cultures. For example, surveys, interviews, focus groups, observation of organization process and practice. You should consider using validated tools and frameworks specific to healthcare quality culture assessment. Also, after that, you should to design assessment process, okay? Develop comprehensive plan for conducting the assessment, how you will conduct this assessment, what you need to conduct this assessment, including timelines, participant selections, data collection methods. Okay, ensure that the assessment process is inclusive, involving staff from different levels and roles within organization. Okay, that regarding the data collection, you have to be aware what type of data that you should to collect it, so you will be able to get the appropriate results from this assessment. Okay, so implement the chosen assessment tools and collect data. This may involve administering surveys, as we mentioned, conducting interviews and focus groups. Okay, encourage open and honest feedback from participants to gain accurate insight into organization quality culture. However, you are encouraging for open and honest feedback, but at the same time, you have to ensure and maintain confidentiality, because it's not easy to get open and honest feedback from the stakeholders, from the frontliners. Okay, so you have to be sure nothing will be considered against them when they share their concerns, when they share any negative feedback. Okay, it is, for example, for you and for the leaders, this is a negative feedback, but let's to take it from other view. Okay, these are concerns of the frontliners, and they are the one who's facing the difficulties more than you as a leaders or as a managers or as a quality members. Okay, so this is regarding data collection. After that, when you collect and gather the data, you should to analyze it. So analyze the collected data to identify the patterns, the themes, the key findings. Use qualitative and quantitative analysis techniques to gain comprehensive understanding of the organization's quality culture. Okay, you have to look for the strengths, weaknesses, opportunities for improvement. It's very important in this phase to analyze it carefully. Okay, because your outcome or your purpose or to achieve your objective from this assessment will be depend on this phase also. That's why it's very important to assign qualified persons, okay, for such of this project. يعني هنا ننسى, you have to forget your friendship relationships, your preference people. You have to utilize qualified or assign qualified, knowledgeable persons. Could be more than one person, by the way, because you need a team here. Okay, to lead this project and to create an effective team. Be sure that you have good members in that team, able to understand how to assess and how to analyze. Also, I will repeat again, you should to maintain confidentiality and to ensure that these people are accountable if there is any breaks with the confidentiality, okay, or any staff from the frontliners got harmed because of that break confidentiality. Next, after that, identify the areas for improvement. When you analyze, you should to identify the areas for improvements. That's why we mentioned you should to know what's the strengths, what's the weaknesses, and the opportunities for improvement. So based on the analysis of data, you should to identify the specific areas where the organization can enhance its quality culture. Okay, this may include addressing gaps in knowledge or skills, improving communication, collaboration, strengthening leadership commitment, enhancing patient engagement, increasing staffing could be, okay, changing process completely. Okay, so, and you have to be clear. When you decide that you need to change a process, you have to be firm with your decision. You have to be accurate and you have to be firm because you have to implement it. Number 7, develop action plan. That's why we said you should to implement it. So develop action plans to address the identified areas for improvement. These plans should include specific strategies, goals, and timelines for implementing changes and for fostering a culture of quality. Okay, engage relevant stakeholders and ensures that action plans align with the organization's strategic objectives and aligns with the vision and mission of that organization. Why we have to engage relevant stakeholders? يعني when you analyze the data and come up with the strengths and weaknesses and you identify the failures or gaps, you will be able to analyze it according to مثلا at unit levels or at service levels or could be at positions levels. يعني مثلا على سبيل المثال, you'll be, for example, you'll be able to identify strengths and weaknesses and opportunity for improvements at for physicians. based on their positions for consultants, for assistant consultant, for fellows, for specialists, for residents. Okay, you can specify also for residents اللي مثلا from 0 to 3 years experience, from 4 to 6 years experience وهكذا. Okay, you'll be able to analyze it in that detailed. Okay, that's why very important to employ a qualified staff with uh, what they call it, with يعني efficient effective system that you have it to be able to analyze this data. طيب كمان implement changes after that when you come up with the action plans. Okay, you have to implement these changes. That's why we mentioned you should to engage the relevant stakeholders. So for example, if you want to implement these changes to the pediatric service, I should to involve the pediatric chairman of the pediatric service. I should to involve the deputy of the chairman. I should to involve the quality specialist or medical quality director of that pediatric service. Okay, so why I have to involve them? I have to involve them because they are the expert about their service needs. They are the expert about their policy and procedures and protocols. Okay, they are the expert about their population needs. Meaning population needs. Who are the population needs? Patients, pediatric patients. أنا بتكلم الآن, we are talking now as example pediatric service. So that's why you should to engage them. Okay, when you engage them, it will be easier for you to implement the changes. Okay, especially when they will when you explain to them the benefits and the value of these changes. Okay, so execute the action plans, implementing the identified changes to promote a culture of quality. This may involve training programs, policy revisions, process improvements, communication campaigns, or other initiatives aimed to enhancing quality awareness and practices. Monitor and evaluate after when you apply the actions. Okay, after when you implement the actions, you should to monitor and evaluate these actions. So by conducting continuously monitor and evaluate the impact of the implemented changes on organization quality culture. Use the appropriate metrics and indicators to measure progress and assess the effectiveness of the intervention. Okay, at the end, sustain and spread. Okay, after when you evaluate these actions and you are satisfied with the desire and you reach the desired outcome, you should now to work to sustain this changes. Okay, and for example, you implement this change at service level, only at one or a specific zone of services. Okay, so after that you can be able to generalize these changes. So embed the desired quality culture into the organizations, foster continuous learning environment, provide ongoing support and resources, celebrate success, share the best practices across the organizations. Could be also not only across organizations, later on also you will be able to share this with the external organizations as a success project. So encourage staff engagement and ownership of quality initiatives to sustain and spread culture of quality. So this is the purpose from assessing the culture, the quality culture. So executing quality culture assessment is a process that requires ongoing commitment and involvement from leadership, staff, and stakeholders. It serves as a foundation for continuous quality improvement, helping healthcare organizations create an environment that support and prioritize the delivery of safe, effective, patient-centered care. Why we mention here that involvement from leadership, not only staff and stakeholders. Why? Can somebody explain? Implementing or executing quality culture assessment is a process, as we mentioned, that requires ongoing commitment and involvement from leadership. Why you need the involvement from the leadership? Set example for the other employee, and also they empower the change. Okay, excellent. What else? Why you need the involvement of the leadership? Okay, involvement of leadership, as we explained previously also, if you remember, yes, for authorization. Great. Okay, for authorization for implementing. طيب. Also, يعني for support, for their support to implement the changes. Okay, also to ensure that these changes will be implemented correctly. Okay, that's why you need the involvement of the leadership and the support from the leadership. Okay. طيب, quality planning process. The quality planning process involves developing comprehensive plan, as we mentioned, to improve the quality of care provided by the organization. It focuses on setting goals, defining strategies, outlining specific actions to achieve desired quality outcomes. This is the conclusion now. The process helps align the organization's resources, activities, and initiatives toward quality improvement. Okay, by conducting quality culture assessment and following the quality planning process, healthcare organizations can systemically assess their quality culture, set goals, and implement targeted strategies to improve the quality of care delivered to patients. These processes contribute to continuous cycle of quality improvement and ensure patient-centered and outcome-driven approach to the healthcare. Okay, so it is what these contribute to continuous cycle. Okay, very important to consider that this is a continuous cycle. طيب, what are some challenges that healthcare organizations may face when implementing these strategies? When you implement the quality assessment and the process that you should to apply changes, actions to be taken, what kind of challenges that could be faced or barriers? Okay, من ناحية resources, what does mean resources? Can you be more specific? Lack of resources or insufficient of resources or what? What else? For change, you may need budget. Yes, excellent. Come on. Yes, you need a budget. That's why we need support of leadership, consistency. That's why we mentioned that you should to apply the specific tools to assess and evaluate the effectiveness of the actions to maintain the sustainability and consistency. But what's the challenge that related to the consistency? Resistant to change, yes. Resistance to change. This is the nature of the people. This is the nature of the human. They will be scared from the changes, okay? Or could be also, if you noticed, different aging from the staffing, okay? It will impact also, or it will be as a factor for resistance to change, because different aging coming from different schools. Okay, I have the what does mean different aging؟ لأنه أنا عندي هنا different aging it means I have that old traditional people, okay, let's say staff, old traditional staff that they don't like to go with the changes, they like to go with the routine tasks, what's they used to do without applying any changes because they believe if you change, it is not right. Okay, more work impaction. What else? When you implement changes, okay, we mentioned that you need the resources, budget, you should to maintain the consistency, okay. How you can uh, avoid this resistance to change? Okay, it's here in front of you now. Okay, as we mentioned, resistance to change from the staff, resource constraints, as we mentioned, including financial limitations and staffing shortage. Okay, lack of data and information system that can serve you to implement that actions. Difficulty in engaging and obtaining buy-in from staff members. Okay, alignment of strategies with existing process and workflows. Sustainability and spread of implemented changes. Okay, command data privacy and security concerns could be limited time and prioritization of initiatives. Resistance to transparency and sharing performance data, external factors and regulatory requirements could be also one of the challenge. Okay. Also, what are the strategies that can healthcare organizations use to address these challenges? Okay, you can address these challenges, okay, through change management by maintaining clear, open communication, staff involvement, education, through resource optimization. Okay, you should to assess your needs, optimize the resource allocation, seek for external funding or partnerships, through data infrastructure and analytics, by invest in robust data system and analytic capabilities, also by coming with a sustainability planning, establish metrics, embed quality improvement into culture, provide ongoing support. Regarding process integration and redesign, align strategies with the existing process, involved frontline staff, educate them about these changes, staff engagement and training, as we mentioned, educate them, train them, inform them, keep them updated about the changes, take their opinion even before applying these changes. Okay, data privacy and security measures, which is very important. Implement robust protocols and staff training on privacy and security, prioritization and time management, prioritize initiatives, develop realistic timelines. No need to pressurize yourself and pressurize your team. Okay, streamline process and standardize it. Transparency and communication, as we mentioned, by sharing performance data openly, engage stakeholders, external collaboration and adaptation. Stay informed and collaborate, adapt to changes. All of these you will be able to enhance your system and culture. Okay, still we have a time till 12. So let's to continue here with the profiles, categorize and selection criteria of healthcare quality indicators. Okay, so to identify the selection criteria for healthcare quality indicators, here are some key selection criteria for that. Regarding the KPIs or healthcare quality indicators, should be relevance, Okay, the indicator should be directly related to the aspect of care or outcome being measured and aligned with the organization's goals and priorities. It should capture an important aspect of quality that is meaningful to the patient, providers, and stakeholders. Should be understandable, can be measured, can be assessed, okay? And aligned with your vision and mission at unit level or at service level and at organizational level. Validity, what does mean? The indicator should have sound scientific basis and be based on evidence or best practice. It should accurately measure the intended concept or outcome and have been rigorously tested and validated. Okay, and you have to be very careful when you select the indicators. Also, reliability, the indicator should produce consistent and reproducible result over time and across different settings or providers. It should have a low level of measurement error, okay, and be reliable in capturing the true performance or outcome being assessed. Feasibility, what does mean? The indicator should be feasible to measure within the available resources, data, system, infrastructure of the healthcare organization. Okay, also as we mentioned previously, measurability, the indicator should have a clear and well-defined measurement methodology with a specific numerator and denominator definition. The data required for measurement should be readily available or can be collected with a reasonable effort. Also, sensitivity to variation. The indicator should be able to detect meaningful differences in performance or outcome among the different providers, settings, or patient population. It should be sensitive to change in care delivery or interventions and capable of identifying areas for improvement, which is very important. Yani, when you select or when you consider this point, sensitivity to variation, when you set your indicator, because you will be able to measure it efficiently, and it will give you an accurate result. Actionability, what does mean? The indicator should provide you actionable information that can drive quality and for improvement efforts. It should be able to guide decision making, identify areas for intervention, and facilitate the implementation of targeted improvement strategies, because our purpose and objective from setting KPIs is to not to get data, not only to get the numbers, quantity. No, you should the purpose from this data that can be transformed to actionable information. What does mean actionable information? That this data can be transferred to information, and this information can be analyzed and action can be taken based on that information. Okay, that's why you should to select appropriate, accurate indicators and measure it carefully, correctly. So you'll be, because based on that, you will be able to take the appropriate actions to improve your system, and you will be able to take the correct decision making because of that information. Also, based on that indicators, you will be able to utilize it as a benchmarking, as we mentioned, internally or externally. Patient-centered, also these indicators should reflect the aspects of care that are important to the patients and capture patient experience, outcomes. Also, it should focus on patient-centered care and reflect patient perspective and priorities. Also, continuity and longitudinal monitoring. These indicators should be suitable for continuous monitoring over time to assess trends, track progress, and evaluate the impact of improvement efforts. It should enable longitudinal measurements and support ongoing quality improvement initiatives. because your purpose from these indicators not for a specific period of time. You should to select the indicators that you can measure it over time to assess trends, to track the progress later on also. Okay, these regarding the indicators, differentiate between the input, process, outcomes indicators. If you remember previously, we explained about the input, process, and outcome, and we correlated the quality with the inputs and process and outcomes. Now we'll speak about the indicators for each phase. Okay. So for the input indicators, okay, regarding the definition here is input indicators measure the resources and the infrastructures invested in delivering healthcare services. Okay. So if you would like to participate on this, if you remember when we mentioned regarding the input, okay, input, process, outcome. Input, which is our structure, okay? When you enter the data, for example, by specific type of staff, by utilizing specific type of resources, these all your inputs, okay? So here, the inputs indicators, it will measure the effectiveness of your resources, the infrastructure that invested in delivering healthcare services. Okay, here you should to focus on the inputs or resources allocated to the healthcare, such as staffing levels, equipment, availability, financial resources, the infrastructure. Okay. Do you like to give any example related to that from your experience or from your workplace? Okay. So as we explained regarding the input indicator, okay, you have to set the appropriate indicators, the KPIs that can measure the resources and infrastructure that invested in delivering healthcare services, that you'll utilize it to deliver the healthcare services. For example, number of healthcare professionals per capita, availability of medical equipment, healthcare facility accreditation status. Also, the second phase, which is the process indicators, here you should to select the appropriate process indicators that measure the activities or procedures, actions performed during a delivery of healthcare services. Okay, here you should to focus on process and activities involved in providing care, such as adherence to the guidelines, clinical guidelines, utilization of evidence-based practice, patient safety, practices. Initially, at the beginning of our sessions, one of the team, okay, mentioned if there is no documentation, how we will be able to measure the adherence to the clinical practice guideline. Okay, طيب. Here, how you will be able to measure it from documentation. And documentation يعتبر part من البروسيس، صح ولا لا؟ So that's why when you document, okay, يعني you should to specify specific KPIs, okay, to measure a specific, for example, point, okay? How you'll be able to set that KPI from specific fields in your documentation, your staff documentations. يعني for example, how you'll be able to measure patient satisfaction من ناحية pain management. This is a question for you now. Okay. طيب, how you'll be able to measure that? You'll be able to measure it if you are documenting the pain assessment to the patients, okay, that entered by nursing and physician, because should be entered by both, because should be assessed by both, by nurse and by physician. صح ولا لا؟ طيب, so you can specify your KPI about اللي هو appropriateness of the patient pain assessment by conducting audit, by reviewing the pain assessment that entered by nursing وكمان by the physician side. Okay, this is one of the KPI. By the way, this is at مثلا unit level or at position level. في عندنا كمان other KPIs at organizational level. One of them, for example, is self-extubating. Self-extubating. عندنا anesthesia, صح؟ طيب, how you'll be able, or why we have to measure and set self-extubating as a KPI for the organization. From your understanding and now from our lectures, why we have to set self-extubating as a KPI to be monitored at organizational level. أنا بتكلم not for specific services, not for anesthesia, not for ICU only. خلاص تعبتوا? You don't wanna be interactive? طيب, we have to as organization, you have to monitor self-extubating cases. راح أعددهم لكم بعض الأشياء. self-extubating cases, you should to monitor pressure injury, you should to monitor patient fall with harm and without harm. Okay, you should to monitor patient fall. كمان you should monitor yes, serious medication safety incidents. هذا غير السنتينل انسيدنت كمان. هنتكلم يس قلناها البريشر انجري اللي هو البريشر ألسر جاكلين. يس اوكي. كمان what else let me to remember. yes الكاوتي وكلابسي الانفكشنز things. why these all of these should be monitored at organizational level. If you remember, we mentioned these things should be monitored continuously at organizational level and at unit level. Okay? Why? Because it will reflect the, yes, the hospital acquired infection. Yes, right. This should be monitored. Why should be monitored? Because it will reflect the, and it will measure the clinical performance of your organization. I'm not talking only at unit level. يعني at unit level, for example, عند ال ICU they should to measure the pressure ulcer اللي هو احنا we call it كمان pressure injury because it is injury. Okay. الفول, الهاند hygiene, hospital acquired infection. Okay, this is at unit level. Also, these things should be measured at organization level, because you are, as organization, you should to measure your performance, the effectiveness of your performance. لأن زي ما ذكرنا, because these things it will give you clear picture about your clinical performance and about your adherence to the guidelines. In addition, also, it will give you or it will raise a question about the financial harm. Okay, يعني you should to consider it from all aspects. Okay, this is the process indicators. طيب, outcome indicators. Outcome indicators measure the results or outcome achieved as a result of healthcare intervention or services. Here you should focus on the impact of healthcare on a health status, patient experience, overall health outcomes, مثل mortality rates, readmission rates. Why we have to monitor readmission rates? Why we have to monitor readmission rates, and is there a specific timing or a duration that should be considered when when I have to include يعني readmission and counted under readmission rate? Excellent, 24 hours. Less than 48 hours, yes. وكمان readmission 30 days readmission 35 from procedural cases could be, yes. Okay, so why we have to measure it and monitor it? Why we have to monitor the readmission rates? It will reflect what to us, and it will trigger and alert us as organization managerial, quality, safety. It will trigger what? This rate, readmission rate. يعني if you discharge your patient before 2 days ago, and tonight he was in the ER suffering from, let's say, chest pain and required readmission again, what you'll interpret that? What does mean? What it will reflect you? It will reflect your management as a service, yes, treatment effectiveness, medical treatment or medical management. And this is the first question. Okay, that's why we should to monitor it. Did we apply the effective treatment and medical management to that patient when he was with us before 2 days ago or not? Could be that patient was admitted, okay, almost for 2 weeks or 1 month in our hospital, and I discharged that patient before 2 days ago, and just tonight he came back to the ER that required another admission. It will reflect what? That patient could be not treated very well, effectively, could be a risk for, risk for complication that could be not detected before discharging a patient, could be, yes, immature discharge, yes. Okay, okay. Here, question, are there any specific challenges that healthcare organizations face when selecting quality indicators? Yes, okay. first challenge, it's not only for the organization, even at unit level or at service level, data availability and accessibility. This is one of the biggest challenge, unfortunately, that you face it when you select the proper indicators. Difficulty in accessing and obtaining the necessary data for certain quality indicators, which may impact the visibility of the measurement. Okay, resource constraints, okay, limited staff time, limited technology, okay, because as if you remember, I mentioned that you need qualified persons with proper technologies available, okay, because you need it when you analyze it, okay. So also this is one of the could be resource constraints. Financial resource available for implementation and measurements of quality indicators. Also overemphasis on process measures, okay, tendency to focus on easily measured process indicators rather than outcome measures that reflect the true impact of care on patient outcome. Okay, so an example is placing more emphasis on compliance with medication administration protocols rather than measuring the patient's health outcomes. Yani some of the services or some of the let's say leaders, they will prefer to go with the easy KPIs to measure it, okay, because they do not want to challenge themselves. Could be they are scared about data, or could be they do not want to also go with the more complicated KPIs because they do not want to reflect their practice to the high managerial people. Maybe they will be scared from blaming, or they do not want to give a negative picture to the high managerial. Alignment with the stakeholders' perspectives, balancing the priorities and perspectives of different stakeholders when you select the indicators that reflect their varying definitions of quality. Okay, that's why it's very important when you select the indicators that you should to define it clearly to the stakeholders. Okay, take take their opinions about this. Okay, and if they don't have that knowledge about it, you should to explain it clearly for them with evidence. Measuring complex and multi-dimensional concepts, challenges in capturing the multifaceted nature of equality, such as patient experience or care coordination with a single indicator. An example is measuring care coordination, which involve multiple elements such as timely referrals, communication among providers and patient transitions. This is this will be considered one of the complex indicators that could be performed for such of these things. I'm not sure if you have any comments or experience that you would like to share it regarding how to measure the effectiveness of care coordination among multiple services. Yani, for example, if you are working in surgery services, okay, let's say, what do you want? Which surgery? Let's say orthopedic, okay, orthopedic surgery department, okay, and you have a patient that you booked him for a procedure. However, this patient has a cardiac history. What you have to do before booking, proceeding with the booking for a procedure for your patient? Cardiac consultation. What else? When you book a patient for procedure, do you need only cardiac consultation? I know he has a history of with the cardiac issues. But what else you need? You need anesthesia, pre-anesthesia assessment. Okay. طيب. So, orthopedic patient with a cardiac history could be also oncology patients that you need to refer them to the oncology service. Okay. So he need to be assessed by cardiac. He need to be assessed by medical oncology service and also by pre-anesthesia to clear him for the procedure. Okay. This process, okay, you should to implement it efficiently to maintain proper care coordination. Okay, how you will be able to coordinate to ensure your patient complete the cardiac consultation, the medical oncology consultation, and pre-anesthesia, and come back to you as an orthopedic to decide to proceed or to hold the procedure. Only by documentation. What else, Hiba? So, Dr. Hiba, what else? As orthopedic, you'll write or you document your input, your assessment, and your plan for your patient in the patient chart or in the patient file. Okay. But how you'll be sure that you'll maintain a proper care coordination to your patient? By providing him appointments. Okay. How you'll be sure these appointments already done and your patient attended to his appointments? Any thoughts? Okay. Did you feel a challenge to answer these questions? Yes or no? Yes. That's why we call it measuring complex and multi-dimensional concepts. With care coordination, measuring care coordination, one of that. It's really challengeable to set a specific KPI, okay, to measure الcare coordination sorry الcare coordination, okay, among multiple services. That's why some of the KPIs, unfortunately, will be difficult to measure it. Okay, so this is one of the examples. Also, limited standardization, the lack of standardized indicators makes it difficult to compare performance across different settings or providers, okay? Such as surgical site infection cross different healthcare organizations, make it challenging to compare performance accurately. Okay, if you will not be able to standardize indicators, you will not be able to measure it. Okay, unintended consequences. The selection of certain quality indicators may lead to unintended consequences, such as gaming or focusing on specific metrics at the expense of overall quality. Also, evolving evidence and best practice, keeping up with the latest evidence and best practice and quality measurements while maintaining consistency and stability in the measurement over time. This could be help you to set the appropriate KPIs also. These challenges require careful consideration and balanced approach when you select quality indicators to ensure they are feasible, relevant, aligned with the organization's quality improvement goals. Thank you. Okay. I prefer to go for break before going with the quality management tools because I needed to be awake and active when we start this session. So it was our decision to start with our break at 12. But if you allow to me, if we can start now and come back at 12:15. باقي الكواليتي مانجمنت تولز راح أغطي فيها الفوكس بي دي اس اي. اوكي، وراح أعطيكم فيها just a few information about يعني about quality tools in general. حاول أخلصها يعني خلال ساعة ونص. انتوا تفاعلكم معي أمانة يعني ممكن يكون أقل. اوكي طيب، يعطيكم العافية، نلتقي الساعة 12:15. شكرا جزيلا لكم. السلام عليكم جميعا، يعطيكم العافية. Can you confirm? Can you hear my voice? Is it clear? حلو. يلا يعطيكم العافية. So let's to start quality management tools. Okay, which is a very important session now to introduce you to the and define the quality, most of the quality management tools that can be utilized when you want to enhance any changes or improvement in the system or process. Okay, sorry, I'll minimize this. Okay, so quality management tools are techniques and methodologies used to identify, analyze, and improve various aspects of quality within an organization. These tools help in measuring, monitoring, and managing quality to ensure products, services, and process meet or exceed customer expectations. Okay, so the purpose from these tools and utilization of these tools is to um, help you to measure and monitor and manage the quality to ensure that your product or service or process sorry, meet or exceed the customer expectations. Okay, it's not necessarily the customer also, maybe some of the process or some of the services or products to meet your expectations also. Okay, طيب, so here some of the commonly used quality management tools. Okay, flow charts, the first one. Okay, I'll explain later about more detailed about the flow charts. However, flow chart is a visual representations of a process that help identify inefficiencies, bottlenecks, and opportunities for improvements. Okay. I'm sure you are aware how the design of the flow chart, because the flow chart, it will help you to review the process from A to Z, from the beginning until the end. Okay. Cause and effect diagrams, which is this one. Cause and effect diagram. Let me to ask you a question. معلش سوري. عندي الجيران بدأوا يطلعوا أصوات طقطقة وهاي الكلام ودريل. تسمعوا دي الأشياء ولا واضح الصوت عندكم؟ يقصد صوتي واضح بدون إزعاج. أوكي كلير حلو. طيب thank you. So cause and effect diagrams, okay, which we call it اللي هو fishbone or ashqua diagrams, okay, which is this one. Okay, used to identify and analyze the root causes of a problem or quality issues by categorizing potential causes into different categories. Okay, this is regarding the fishbone. I'm not sure if you are familiar with this. Okay, let me to explain also Pareto, then we'll open the chat for more questions. So Pareto chart, which is this one, okay, it is a graphical tool. We call it graphical tool, okay, that prioritize problems or causes based on their frequency or impact, allowing organizations or allowing you to focus on the most significant issues, okay, over that time. طيب. So let's to open the chat. شي هنا. Okay. So what does this mean, or what do you know about cause and effective diagrams? I'm sure flow chart you are aware about it. Unless if anyone don't know about it, we'll explain it by the way later on in other slides. Are you aware about the fishbone, or did you heard about it in one of the, for example, RCA or any analysis that you experienced it before? Okay, brainstorm all causes of the problem. Yes, that's why we call it, or they call it, a cause and effect diagram, because as you mentioned now, brainstorming about all the causes. Okay, you'll and you will bring all the causes or all the possibilities that cause that problem or the cause that incident and the effect of the cause. Okay, طيب. What about الباريتو chart? الباريتو chart. Did you utilize it before? Pareto chart, when you have a data that you'd like to prioritize what's the problem or causes based on the frequency. Okay, frequency of that cause or the frequency of that problem. Okay, it will measure for you the problem or the cause with the frequency of that cause. The frequency of that cause. Okay, over the time. طيب. let's go back to the fishbone. The fishbone, as you can see here, you should to state the problem or the effect. Okay, let's to focus on problem or incident. Okay, هو شكله زي شكل الفش. Okay, so here you should to state what was the problem. Then you should to state or mention the possible causes. What's the possible causes related to the machine? What's the possible causes related to the staffing, or you can call it manpower? What's the possible causes that related to the method or process? What's the possible causes related to the materials or resources that I have it, or equipment? Machine can be equipments also. Okay, or also what does mean 5 ms? Okay, I got it, but if you can document it for your colleagues. Okay, so this is the fishbone. By the way, it's not necessarily to stick to the 5 Ms or to the machine, mass, material method. It's based on your incident. Okay, I will give you example. One of the incident was related to nutrition service. Okay, that our nutrition service delivered wrong nutrition formula to a patient, health outreach. Yani it was delivered by one of the company to the patient home. Okay, so here this incident, we dispensed wrong formula to wrong patient. Alhamdulillah was counted by the patient. They raise the question, they communicate with the nutritionist why you changed the formula. It wasn't taken by the patient. So Alhamdulillah, patient survived, okay? Otherwise could be cause death. However, it will not stop you to conduct the RCA, which is the root cause analysis. Okay, you should to analyze that incident. How one of the tools that utilize to use it, okay, which is the fishbone or cause and effect diagram. Okay, so the problem here I can mention, okay, wrong nutrition formula was dispensed to wrong patient. Okay, it was supposed to be for one of other patient, but it was delivered for wrong patient. Okay, I have to state here what, for example, the process. Okay, what was wrong with the process? Okay, what was wrong with the staffing or manpower? Okay, at that time, two different staff. One of the staff was initially reviewed and validate the order, but it was different than the staff who received the item and checked and applied the label and give it to the delivery company to deliver it to the patient. So I have two involved staff, okay, and at different two phases. Okay, here, for example, under, for example, technology. Okay, if there is any issue with the technology, for example, the system allowed to them to open two different or more than patient chart at the same time. Okay, this is can be written under technology or also under process. Okay, materials, for example, it is for example, in that incident, yeah, the products, okay, the nutrition products labeled only by one label. Yani I have 10 boxes dispensed to the patients, was only one label applied to one box. Okay, so here you can this يعني by the way, you can generate more than one more than four classification. Okay, so it will make it easy for you to analyze your incident, okay, to classify the contributing factors that led for that incident. So you can classify the causes and the effect of that causes that led for that problem. Okay, Is it clear? Okay, so let's go to the next. Here we have the control charts. Okay, control charts, which is statistical tools that monitor process performance over time, identifying variations and trends that may indicate quality issues. And I have the histogram, okay. A histogram graphical representation of data distributions, providing insight into frequency also and distribution values, helping identifying patterns and abnormalities. Scatter diagrams, which is this one used to analyze the relationships between two variables to determine if there is a correlation or causal relationships. However, these tools, okay, in addition to the Pareto chart, these graphics tools, useful tools that you can use it when you generate a report about data. Okay, so you have to select the appropriate graph to present your data. Okay, because this is the beneficial of these graphics that will help you to present your data efficiently, because it's very important for the audience to present the data to convince them also when you need their agreement, for example, to get their attention about that issue or about that problems. However, the cause and effect diagram, and the flow chart, okay, the flow chart and the cause and effect diagram, which is a fishbone, both these tools are very important and useful and beneficial for you to utilize it when you wanna present an incident or issue that happened, okay, and why it was happened, okay, or what's the causes behind of that issue. The flow chart, you'll be able to use it to present the process of that incident, how it was happened, okay, the sequence of that incident, how it was happened. And you can compare it with the actual correct process also. طيب. Here also would like to speak about the checklist. Okay, checklist, which is a simple list, okay, of criteria or steps to ensure that all necessary tasks or quality requirements are met, which is very simple checklist. Okay, I have a specific task 1, 2, 3 to be already listed, and I have to follow it to be sure in a number 1 met, then number 2, then number 3, and so on. Okay, regarding benchmarking, as we mentioned previously, benchmarking, comparing an organization's performance or practice to those of industry leaders or best-in-class organization to identify areas for improvement. In benchmarking, as we mentioned, this can be comparing with either internally or externally. Okay, the 5 whys. What do you know about 5 whys? إن شاء الله راح أطلب منهم أن يعرضوها لكم. طيب ال... طيب بالنسبة ال 5 whys, what do you know about ال 5 whys? It's written here. Or did you hear about it? For quality things, for incidents or safety issues, OVR, whatever you call it. We use it in RCA, yes, yes. Okay, why you have to use it in the RCA? من اسمها 5 whys. Why we have to use it in the RCA. طيب The 5 whys is a technique used to repeatedly ask why to identify the underlying root cause of a problem or quality issue. Okay, زميلنا بيقول إنه to know the reasons which led to the event. Yes. As you can see here, we call it 5 whys, by the way, but it's not necessarily that you have to ask only 5 questions. You have the problem. There is a problem occurred, okay, or there is safety incident happened, okay, whatever you want to call it, quality issue, problem, safety incident, but there is something happened, okay, and despite reach the patient or not reach the patient, but I have a problem or incident happened, and you want to analyze it, okay, you want to know the reason behind that incident that happened or why it was occurred, okay. You have to ask why it was happened, why you did that. طبعا هذا when you investigate the other parties, okay. For example, incident happened because nurse gave wrong medication. Okay, hereafter when you analyze and investigate and communicate with the head nurse, with the physician of that patient, with the pharmacy who dispensed that medication, okay. For example, you'll interview also part from investigation. You should to interview involved stakeholders, involved staff in that incident. Why you have to interview them? You have to interview them not just to know them. You should to hear what was happened, okay, and why it was happened from their side, because the incident was happened with them and by them. Okay, and they are the most resource. They will give you the exact incident what was happened, okay, and you will be able to detect the reasons behind that problem that led for that problem, okay, and you reach the root cause that led for that problem. That's why I will investigate with the physician that could be he prescribed. Let's to start with the nurse, okay. I will start with the nurse. I will interview the nurse why you gave that medication. For example, let's say she will answer, okay, was delivered by the pharmacy. Okay, did you apply double independent check to that medication, the 7 rights of the medication? Okay, so was applied correctly? Did you compare it with and check with the physician order? Okay, then we discovered it was wrong order entered by the prescriber. Okay, that's why because of wrong prescription from the physician was submitted under the patient chart, was reached to the pharmacy, and the pharmacy, they assumed this to be prescribed to the patient. Okay, after when they review, they didn't raise any question why, for example, it was prescribed to the patient, and they didn't communicate with the physician because they believed the physician prescribed it correctly to the patient. Okay, so after that, they reviewed and validate the order. They prepare it and dispense it. They delivered to the nursing unit. The nurse, she assumed this is what was prescribed by the physician, and they check the medication. It was then administered to the patient. So the main root cause was wrong prescription from the physician. Okay, and it was not detected by a clinical pharmacist. Some of the areas I have a clinical pharmacist, and they will be able to review a patient chart, and they can detect some of the medications why it was prescribed for that patient, because there is no relation to administer that medication or to prescribe that medication with that diagnosis of the patient. Okay, so this is the purpose of 5 whys. Yes, it will be used in the RCAs or when you analyze and investigate your the incidents. Okay, and it is not limited to 5 whys. You can ask more questions of whys. Okay. Also, I have the Lean Six Sigma. Okay, Lean Six Sigma is a combination of lean principles, which is reducing the waste and improve the efficiency of the process, and Six Sigma methodologies, which is reducing defects and variability to drive process improvement. Okay, so here, as I mentioned, Lean Six Sigma, it is actually two methodologies combined, which is Lean and Six Sigma. Lean, it will focus on efficiency through the minimizing the waste and errors. Six Sigma focus on quality and consistency, and as we mentioned, reduce the defects and variability. Okay, it will give me Lean Six Sigma that you'll get both delivered to deliver the customer value through efficient operations and quality standards. Okay, so how the Lean Six Sigma it will work? First, you have to define the problem. Then you should to measure that problem. Okay, you should to quantify the problem. You should to analyze it by identifying the cause of the problem. You should to, after that, come up with the action and implement and verify the solution. After that, when you assess and evaluate and you reach the desired outcome, you should to control it and maintain the solution, which is the sustainability. Okay, and this is continuous process where you should to apply this process when there is any new problems exist. Okay, so the main purpose from Lean Six Sigma, Lean is to remove the waste. What does mean reducing the waste or remove the waste? When you review the process, okay, when you review the process, you identify there is or there are some of extra steps in that process that unnecessarily to be followed, okay, or to be added, because if we'll continue with these steps could cause harm to the patient or could impact the quality of that process. Okay, that's why the purpose from the lean or applying lean principles is to reducing the waste. Okay, is it clear? Great, thank you. Do you have any questions so far about the tools? طيب, let's continue. طيب, what is performance improvement? What does mean performance improvement? Okay, as per the International Society of Performance Improvement, the definition is a systemic approach to diagnosing and solving problems related to human performance and productivity in workplace. Performance improvement is focused on delivering results-oriented outcomes that are measurable regardless the type of a problem or method of intervention selected. Okay, so what does mean performance improvement is a systemic approach. You should to diagnose, analyze, and solve the problems that related to the human performance to enhance the productivity. Okay, what is performance improvement also as per the GCI? An approach to the continuous study and improvement of the process of providing health care service to meet the needs of our patients and others. This is as per the GCI. I think it's clear. It is a systemic approach, continuous study to apply the improvement. Okay. Reasons for performance improvement plan. Why I have to apply improvement to our performance? Okay, either related to poor performance, okay, change in the position, fee changing in the positions that require that I should enhance the performance. طيب decreasing perform could be because our performance decreased, so that's why I need to apply this to come up with a project to enhance the performance. Attitudes problems could be additional training that require to enhance the performance or punctuality issues. Punctuality issues what does mean يعني عندي discrepancy في outcome of the process. Okay, sometimes up, sometimes down, or sometimes my customer satisfied, sometimes not. So I have to review the process to enhance the performance. Okay, I would like to share here with you regarding the quality management plan structure, just for your information. Okay, so as you know, who's responsible to apply and maintain the quality and encourage for enhancing the quality of the healthcare process and services is the quality management. By the way, we have the hospital quality management, which is reporting to the Performance Improvement Council. I'm not sure about your organizations. You can share that with me now. It's good to to know your the structure in your organization. Okay, however, they recommended the quality management to be reported to the Performance Improvement Council. Okay, under quality management will be and will be work collaboratively with a nursing quality management committee, with the medical quality management committee, with the managerial quality management committee, with the allied quality management committee, with the patient safety committee, with the accreditation committee, with the mortality and morbidity committee. Okay, any comment about this? You would like to share anything about your organization regarding quality management department and what type of committees that are under quality management? Because if you can see, I have a nursing quality management committee which is addressing nursing quality issues. By the way, some of the issues it will be addressed also that related to the nursing in a patient safety committee, but this it will be multiple disciplinary services involved in the incident in addition to the nursing. But nursing quality only specific for nursing, medical quality management only specific for medical, which is related to the physician side, managerial quality management just for the managerial level, okay, leaders, allied quality management for the allied health services, patient safety committee for the patient safety section, which is under quality management, accreditation committee for the accreditation section in the quality management department, mortality and morbidity. This is very famous, which is mortality and morbidity committee, hospital mortality and morbidity committee. لكن at the same time you are aware in each service I have mortality and morbidity team that they will focus and they will review mortality and morbidity incidents or cases in that service. يعني pediatric service I have a specific mortality and morbidity team to review mortality and morbidity pediatric cases. Okay, any questions so far? طيب, we'll continue. So now we'll move to the focus BDCA, which is related to applying focus BDCA methodology for quality improvement. This is a problem solving and continuous improvement framework commonly used in quality management to enhance the system or to enhance the process. It stands for find, organize, clarify, understand, select. This is for focus. For BDCA, plan, do, check, act. It provides a system approach to identify and address the issues, make improvements, and achieve desired outcome. So if you notice, most of the quality tools has the same concept with the same purpose. It will provide systemic approach to identify and address the issues or problem, make the improvements to come up with the solutions, and to achieve the desired outcome. Okay. Okay, so regarding the focus methodology, which is find, you should to identify the problem or the opportunity for improvement. Okay, you should to gather the data about that problem, what was happened, conducting your observation, receiving feedback from involved stakeholders, get more clarification about it. You should to understand it very well. Okay, so you have to be aware about it and you should to understand it clearly. Okay, after that, organize. What does mean organize? Gather or what you have to do in this phase. Gather and analyze the relevant data, because here you get the data. Here you should to analyze the data and information related to the identified problems. This step involves organizing and summarizing the data to gain insights and understand the root causes and contributing factors that led for that problem. In addition, organize the team that is involved in the selected process or project and assign roles for each members. Okay. طيب. Clarify. What does mean clarify? Define the problem by stating the desired outcome. What's the problem and what should be the desired outcome or an improvement goal? This step involves setting specific, measurable, achievable, relevant, time-bound objectives. Okay, which we call it the SMART objectives. Also, after that, you should to understand the problem. Okay, so conduct deeper analysis to understand the underlying causes of that problem. This step involves using tools such as the RCA, a fishbone diagram, process mapping to identify the factors and the contributing factors for that problems. Okay, select, which is to determine and prioritize potential solutions or improvement strategies. This step involves evaluating various options and selecting the most effective interventions to address the identified root causes. Okay, so select. After when you analyze, you have to select what is or what are the proper actions and solutions that should be decided upon to improve the system and to prevent such of this incident not to happen again. Okay, so this is the focus, which is find, organize, clarify, and cover or understand and select the process improvement. Okay, let's move to the BDCA. Okay, after when you complete the focus, you should to apply the BDCA. BDCA, you should to plan action plan that outlines the steps, the resources, the timeline that required to implement the selected improvements. So you completed the focus, okay? We reached that you decide about the action. Okay, when you select the solutions, you should to plan now, you should to create an action plan. The action plan included not only to list the actions that you should to do it. No, you should to list the actions in addition to the resources that should implement these actions, or that should be utilized to implement these actions, the timeline that is required to implement and complete each action. Okay, and also you should to specify the ownership of that action. What does mean the ownership of that action? يعني I have to specify that action will be handled by which service. That action will be forwarded to heart center or cardiology, let's say cardiology service, okay, to work collaboratively with the HITA to enhance the physician documentation cardiology note. Okay, so this action will be forwarded to the cardiology service. You are responsible within 3 months to work collaboratively with the HITA to build that action. After 3 months, I expect from you, Anna, as a quality management, and to give me a feedback about that action. Was implemented? Yes. Was evaluated? Yes. Okay. Was go live already and utilized by the physicians? Yes. Was there any impacts? Was there any deficiencies or no? They are satisfied. خلاص. Okay, so we'll maintain that action and maintain sustainability. Okay, if not implemented, they should to provide us why it was not implemented, what was the deficiencies, what was the barrier behind that, how can they okay, and what's their plan. Again, what's their plan to implement that action. So they should to work on that barriers. Okay, they should to come up with the solution to proceed with the implementation of that action or to come up with the alternative. طيب, this is regarding the plan. Do execute the planned interventions or changes on a small scale or pilot basis to test their effectiveness and visibility. Okay, so after plan, they should to execute their plan, their intervention, either at unit level or at a specific small scale or pilot. After that, to check the effectiveness of that action. Check, evaluate the results and the outcome of that implemented intervention or implemented action by measuring a key performance indicator and comparing them to the desired goals. Did we achieve our desired goals or not? After that, if we achieved our desired goals, based on the evaluation in this step, take the appropriate actions such as standardizing successful intervention, making adjustment to address shortcomings, or scaling up successful changes across the organization. Yani changes can be implemented initially at a specific zone or at a specific service. Okay, then if you are satisfied and quality satisfied about that changes, they can generalize it. Okay, is it clear so far? To check. طيب. Is it clear so far? Do you have any questions? By the way, these tools, it will be easy for you to implement it, okay, when you practice it. That's why if there is any quality projects in your service, okay, you can ask the permission to be involved in that, or at least to shadow the leaders, okay, to get more information how these things or how these tools can be implemented. Okay, let's continue. There is no questions. Criteria for selections of BI projects, okay, based on what you'll select the BI projects, either high volume or high demand about specific type of, let's say, specific process, okay, and need more enhancement about that process, or high risk process, okay, high cost, also problem-prone issues, or regarding mission or vision, strategy, goals, and available resources, that I have to align my goals or my objectives with the organizational goals, also needs, expectations, and feedback of customers, okay. Performance measures or feedback related to accreditation or risk management. Okay, risk management was conducted and we need to enhance this process, or based on accreditation, surveyor came and they cite us or they suggest us to enhance 1, 2, 3. So also this should be considered. And BI, which is performance improvement project, can be considered. طيب. What are some common challenges or limitations when implementing the focus BDCA cycle? Okay, as we mentioned previously, almost similar, resistant to change, okay, limited resources, could be that you'll not be able to implement or enhance the system fully. Data availability and quality. That's why you have to be sure that you'll get the full access to the data that you needed. Okay, lack of skills and knowledge. Okay, and there is no harm to learn more about how to enhance the system by consulting the quality management department, the qualified staff in your organization to search about how to apply the quality tools. Or it could be you can consult also external organizations for that to help you to enhance your process. Okay, siloed approach, lack of collaboration and communication across departments and teams. This can be considered one of the challenges, unfortunately, also, especially if you need a specific type of data from a specific service and that service doesn't want to share it with you. You have to go with the higher managerial, with the official communication by memos and letters to request that type of data, especially if you will explain the purpose from requesting that type of data is to enhance the process, which is for the organization to meet the needs of our customers, which is our patient. Okay, unrealistic realistic expectations, setting overly ambitious goals or expecting immediate results, leading to frustration and discouragement. Yani when you apply these tools to enhance the system, you have to consider these changes needs time, but you have to be realistic also. Yani not to make it, not to set a very short timeline and to apply these changes, and not to also yani exceed the appropriate timeline, because maybe this it will be forgotten and not will be implemented and you lost the proper follow-up. Also, a sustainability for improvement, difficulty in sustaining implemented changes over the long term without focus on embedding them into standard process. Okay, this it will be considered as challenges. How can leadership support to be obtained for implementing the Focus BDCA cycle? By communicating with them the benefits from benefits from implementing this Focus BDCA. What's our objective behind implementing this Focus BDCA and why we have to implement it? Okay, educate the leaders, okay, with the comprehensive understanding of the Focus BDCA, its methodology and its potential impact on the organization performance, how that will enhance and how that will align you with the vision and mission and the strategies of the organizations. Okay, and by the way, don't surprise that you need sometimes to conduct training sessions, workshops, presentations to the leaders, okay, to explain to them about that, because leaders sometimes they will not be aware about all the quality tools and the purpose of utilizing these tools. Demonstrate success stories. You have to present for them also and share at organizational level, okay, and even within the same organization, the success stories of implemented Focus BDCA and achieved positive results. Okay, these case studies and examples of how the cycle has led to this improvement can powerful in gaining leadership buy-in. You can get easily their attention for future enhancements also. Okay, align with the organization goals as we mentioned previously. We no need to repeat this. Also engage leaders as a champions. Yes, it's very important, okay, when you decide to implement this PI project, okay, it's good to assign one of the leaders, okay, as one of the leadership leaders, okay, or one of the director leaders as a leading for this project, okay, or to involve them, to invite them to attend with you these meetings, to engage them, okay, in early phases of the process. When you review the process, involve them in the planning and the decision making, and empower them to promote the cycle within their respective areas of influence. By that, you'll make them excited, you'll encourage them, you'll increase their curiosity to know more about it, especially when they will see the enhancements. Okay, not only when they will see the enhancement, when they will discover how much that process, the previous process, was placing your patients and your staff and the organization at risk of to conduct more errors instead of providing high quality of care and safety to the patients. Okay, provide resources and support. Ensure that leaders have necessary resources such as dedicated staff, time, and financial support to implement the focused BDCA effectively. Okay, also foster culture of continuous improvement, which is very important. Encourage culture that values and supports continuous improvement throughout the organization. Leadership should promote open communication, collaboration, and willingness to learn from failures and successes. Okay, that's why, unfortunately, some of the services, when you, for example, advise them to conduct focused BDCA for such of a process, they will take it personal, as a personal thing. They will, they will resistant to the change, and they will raise their concern that, for example, are you saying that our process is not right, or no? Are you saying that we are not aware how to do our work? They will take it at individual level. They will, which is not right, by the way. As a quality, you should to focus more in how to enhance the system, not to take it personally. Okay, it is not against you as a chairman of that service. It is not against you as a head nurse for that unit. Okay, it is not against your process or your management and at that unit. Okay, this is we should to maintain and encourage for speak safety quality language, and encourage to enhance the system and maintain the focus to be on enhancing the system to deliver high quality of care and preventing errors. Okay, monitor and communication progress, which is very important, as we mentioned previously. Regularly track and communicate the progress and outcome of the focused BDCA, because you don't want to lose your initiatives and your work. Okay, provide update on key performance indicators, improvement projects, listen, learn from these. Okay, this helps leaders see the impact and the value of their support. So by employing these strategies, healthcare organizations can secure leadership support for implementing focused BDCA cycle and create an environment conducive to continuous improvement and positive change. Okay, here regarding the flow chart is a picture representation displaying the actual and the ideal sequence of steps. So here, this is the example about the flow chart. Flow chart, you should to start with the beginning. What was the يعني the beginning of that system, how it will start. Okay, here and you should to present it with this call it cycle, could be cycle shape. Okay, here you should, by this shape you have to state the process steps. Here if you reach for a decision that required yes or no answer, you have to use the diamond shape. Yes, you should use you state the steps for that based on yes answer. If no, you should to state the process and close it by the endpoints by cycle shape. Okay, this is regarding flowchart. Here regarding the cause and effect diagram, already explained previously for you, but as we mentioned, you should to state the problems here, then you should to classify the contributing factors and the causes and the effects. Okay, so as we mentioned, start with the problem statement, determine and define the major categories of the variations and describe the system or process. Then you should to apply either the 5 PS or beeps, B's or 5 M's. This is what was mentioned by your colleagues. Either you can utilize people, provisions, policies. This is the classification, when you classify your variations. Or you can go with 5 M's, manpower, materials, machines, method, management. After that, when you conduct the BI project, don't forget that you should also to utilize the Gantt chart. Okay, in the Gantt chart you will be طبعا هذا this is in the phase when you plan and when you act. Okay, because by utilizing Gantt chart, you will be able to illustrate the start and finish dates of the breakdown structure and summary elements of the project, and here you'll be able to maintain regular continuous follow-up for each action or for each task. Thank you very much for attending this session, and if you have any question, please you can directly type it on the chat. You are welcome, Sliman. Any questions, team? Any comments? Any suggestions for the next lectures, for example? وسامحونا على القصور if you expect something and you found something else. ترى يهمني your recommendations عادي يعني you can express it. طيب, was useful for you? Did you gain knowledge from these lectures? طيب, راح يساعدوك organizers دكتور هبة regarding the materials, ولا يهمك. الحمد لله. Thank you سارة. إن شاء الله تستفيدوا. Really? Thank you very much دكتور خالد. Thank you all. يعطيكم العافية. طيب, from my side I prefer to add my phone number for any questions or consultation that maybe you need it in future. Okay. يعطيكم العافية جميعا. You can leave. If you want to. مبارك عليكم الشهر ومبارك عليكم العشر أواخر ومبارك عليكم العيد إن شاء الله. كل عام وانتم بخير وإن شاء الله منورين دائما بالعلم والحكمة يا رب. Thank you all. يا هلا فيكم. يعافيكم يا رب. وأنتم كذلك حبيبتي، جزاكم الله خير. طيب، أترككم في أمان الله، استودعكم الله، مع السلامة.